Thank you.
And let me double check, but we may be at quorum. We're good to go.
Great. Good morning, folks. Happy Friday. Hope everybody is warm and dry and looking forward to hopefully you're able to get some additional respite this weekend. My name is Abby Stamp. My pronouns are she, her, and I'm the Executive Director of Measure 110 for the Oregon Health Authority's Behavioral Health Division. And this is the 25th review panel, 6th 2026 review panel for the request for grant applications for behavioral health resource networks using cannabis revenue through the Drug Treatment Services Recovery Fund. Thank you for being here. We're going to talk about Multnomah County today. So just as a reminder for everybody, please keep your reports succinct. We would like to complete Multnomah County this morning. I don't believe we have any additional meetings set next week. And I'm looking at Carly because she's the boss of all of that. So if we don't get through, so we have Multnomah, Washington, and Union, I think are our last counties. So if we don't finish all three of those today, we'll need to find some time together next week. So but we're doing great with our deadline, and the OAC is right behind you. They are like, pretty soon going to start kicking your heels with the progress they're making, and really all in part to the amazing information and deliberations here at these meetings. I do want to remind folks that these, of course, these meetings are recorded and they are public. And so as you discuss the applications you review today, please remember to only include the information that was included in the application. Anything brought into the space about your own experience or your own exposure or thoughts or feelings about the provider or any other systems really should stay out of this conversation. This is about the information that the applicants provided, and that is a job in front of us. It's particularly challenging when we're unable to fact check anything. And I also know that it can be incredibly hard because we are all subject matter experts in our own areas, right? So we're going to stay focused on the job, on the task at hand. I think that's all of my announcements today. Is there any comments or questions before I screen share? We do a call for conflict for the Multnomah County applicants. I'm going to talk fast. And away we go. Oh, I need to attendance. Attendance. Can we have attendance? Oh, thank you, Carly.
Amy.
I'm here.
Hi, Amy. Dharma.
Here.
Hi, Dharma. Keisha. Morgan.
Hi.
Hey, Morgan. And Zeb, let me know he's not going to be here. Abby.
Present.
Ariana. Ane. Dana. Daniel. Danielle. Drew. Elizabeth.
Here.
Emily.
Here.
Evelyn. Grace.
Here.
Hey, Grace. Gregory. Greta.
Here.
Hi, Greta. Hannah. John. Judith.
Here. Sorry, I couldn't get to the mute button.
Oh, sorry. I'm going a little fast.
No, you're fine.
Juliana.
Here.
June.
Here.
Kathy.
I'm here.
Kylie. I think she's out today, right? Kirsten.
She's out.
Here. Good morning.
Good morning. Liz.
Here.
Mark.
Here.
Maya, Megan, Michelle,
Here.
Nicole Corbin, don't think she's here. Nicole Egler,
Here.
Rachel. Sam is not. Sarah Adelhart, Sarah Hubner, Sean,
Here.
Stanley,
Here.
Tammy, Tatiana, Tim,
Here.
and we're quorum with 21.
Thanks, everybody. And thanks for the note, Carly. If anybody has any need to step away for, just let us know. I did hear, Sam's in a meeting with the governor's office, but she can hop on if needed. So there are folks who are, well, one folk in the wings if needed. So, please don't pop out without letting us know. Okay, we're gonna head into Multnomah County. Okay, and I'm just going to flag for our reviewers that up first, and just so you can have your materials ready, are Amy Madrigal and Nicole Egler. All right, so Multnomah County, Oregon. So this is a call for actual or potential conflicts. This is page 1 of 2. I'm going to read all of the applicants out loud. African Refugee Immigrant Organization, Allied Health Services, Tigard, Arbor House, Portland, Autistic Women and Non-Binary Network, doing the Haymarket Pool Collective, Boulder Care, Bridges to Change, Cascadia Project, Cascadia Behavioral Health Care, Central City Concern, Coda Flora Health, Fresh Out Community-Based Reentry Program, Going Home 2, Haven Counseling Collective, Helping Hands Recovery Outreach Center, Iron Tribe Network, Food Toast Northwest, LifeWorks Northwest, Lutheran Community Services Northwest, Mental Health and Addiction Association of Oregon, Metro Plus Association of Addiction Peer Professionals, Miracles Club, Morrison Child Family Services, Mountain View Recovery, doing business as NapStreet Recovery, Multnomah County Health Department, Native American Rehabilitation Association of the Northwest, New Avenues for Youth, Northwest Family Services, Northwest Instituto Latino de Adicciones, Northwest Treatment, Oregon Change Clinic, Oregon Health and Science University, Oregon Recovers, Outside In, Pain and Horse Recovery, Pathfinders, DBA Pathfinder Network, Oregon Health Action Team, Portland Street Medicine Project, Patchwork Project, Providence, Portland Medical Center, Raphael Health of Portland, Recovery Works Northwest, Southeast Works, Silvalti, the Fourth Dimension Recovery Center, the Alana Club, the Everly Project, Insight Alliance, Marie Ecke Institute, Transcending Hope, True Colors Recovery Volunteers of America, West Coast Sober Housing, Women First Transition or Growth Center, and yeah, I don't know how to pronounce this provider, Yasin's Love. Are there actual or potential conflicts of interest for any of these providers in Multnomah County, Oregon? Okay. It's not an actual or potential conflict, but I do want to be transparent that I was an employee of Multnomah County for 20 years. Not specifically of the health department, but want to make sure that that's transparently shared as well. Okay. Process overview for the beginning of our meeting here. Of the 331 applications submitted on or about October 4th, 317 passed the minimum submission requirement. And each of those applications was reviewed twice because of your time and energy. Thank you. And then today we are coming back as a panel review to look at funding recommendations and the application as a whole to better understand the request, but also through a lens of culturally specific services and services to underserved communities. And our job is to provide funding recommendations to the Oversight and Accountability Council. So we may meet as many times as necessary and provide final funding recommendations to the OAC. The panel review must, to the greatest extent practicable, recommend at least one applicant in each service area in each county. For each of Oregon's 36 counties, this review panel must complete a successful majority vote on funding recommendations to the OAC when building the behavioral health resource networks. So already reminded folks about a live meeting and recorded and posted. We will keep the chat open, but please try to make sure that you contribute your voice whenever possible to the conversation. We'll use the chat to, alert of, be right back, I'm back, and I got to take off to a quorum and ensuring the motions are accurate. Just raise your hand. All facilitators to the conversation today. Please, again, please be thorough, but yes, concise. Lots and lots of applications to discuss today. And the Measurement 10 team feeling so grateful for all of the legwork getting us to here today and being available to pop up those applications if needed. Ariana, Greg Bledsoe, who couldn't join us today, just sent his reviews using your tool. So we've got that available for review.
I have them. I can read them.
Oh, beautiful. Thank you. And of course, reviewer first would be great since you know the application most intimately. And then we'll call for a vote at the end. Any questions before I begin? All right, here is the formula. Multnomah County's total is 80.5. Multnomah County is the state's most populous county and includes the city of Portland, which serves as its county seat. Portland is known for vibrant art and culinary scenes, beautiful natural landscapes, and diversifying community. The population is approximately 800,000. The majority of the people are white, but there are significant Black and Asian communities. Strong urban-rural divide, with most of its residents concentrated in the Portland metro area. Portland's a main cultural center with a zoo, museum, and public gardens. The county is recognized as progressive politics, robust public services, and growing focus on sustainability and environment. Household income median is $83,500, 65% white. There's a racial composition. Poverty rate is 13%. Age distribution is 17% under 18. IDD rate is 10%. Low to moderate income is 38%. And employment rate is just over 4%. So again, here are the providers from Multnomah County. Of the 58 applications submitted, 56 passed minimum scoring requirements. The total countywide ask was $313 million, which is $232 million over the formula amount. I think this is page 1 of 4. So our home base is large today. Immigrant refugee, African refugee immigrant community organization. Sorry, I'm trying to talk too fast. African Refugee Immigrant Organization is first up today. And just note that we'll go through and just pay attention to the total asks and program costs and make sure that you're documenting any questions you have. And you'll remember our color coding of green, blue, and orange, which is 2 yeses, 1 yes, and 2 nos. And we'll make our way through this. Let me just verify how many pages. 1, 2, 3, 4. Yeah, 4 pages. So we are going to dive right in, starting with Amy Madrigal and Nicole Eigler.
I'm ready. Okay. ARIO, they call their organization ARIO, stands for African Refugee and Immigrant Organization. ARIO, answer to question 7. ARIO is a culturally specific organization serving African immigrant and refugee families in Oregon, representing over 28 African countries and various ethnic groups. African immigrants comprise about 2% of the foreign-born population in the Portland metro area, with nearly half originating from Eastern Africa, including Ethiopia, Eritrea, Kenya, Somalia. Many of the people whom ARIO serves are refugees and asylees. Both these statuses come with the specific barriers and challenges, including dealing with trauma and displacement, adapting to a new culture, navigating the systems and social environment, and language barriers. While we have the language capacity to serve many African communities in-house, we also collaborate with translation services to ensure accessibility for all clients. The answer for the Medicaid question: no, the services they've asked for, which are screening and peer support, are not eligible for Medicaid reimbursement, and ARIO does not have the ability to bill insurance. Are the peers in the office or field? They are in, it was hard to say, but I assume they're in the office because I didn't hear about outreach events, but I did hear about community events that they host at their office. How are peers integrated into other services? Yeah, screening and assessments is where the peers are at in the office. All other services, they refer out to local organizations. nothing for housing, nothing for harm reduction. Overall, I would say this is a reasonable funding ask, includes funding for community events and workshops with translators included. Sounds like nice events that they host, and it's a good way to reach their specific cultural community.
Thanks, Nicole. Amy, anything you want to add?
Nope. I think she nailed it.
Okay. Any questions for Nicole or Amy on this applicant? Okay, next up is Allied Health Services Tigard, and do we have Ane or oh, not Nicole Silva? Is Ane here? She is not. Okay, Measure 110 crew. Are you opening documents, Kathy? You're muted. Can't hear you. Kathy, you're muted. Oh no. Kathy? Hey, you're on mute.
My apologies. You can't hear me then. I was trying to fix a document. I did a copy paste and it was wrong and I was trying to undo it. And so I was like, I'm glad I was on mute. So we're on Allied, is that correct? All right. For number 7, CRC Health is dedicated to providing trauma-informed. Now, why does it say CRC? Is that correct? Oh, it is. Is dedicated to providing trauma-informed, culturally and linguistically inclusive services. Our staff undergoes comprehensive training in trauma-informed care and cultural competence, focusing on safety, trust, and collaboration. This approach, based on SAMHSA's guidelines, is integrated into all service areas to create supportive environments that empower individuals and prevent re-traumatization. At admission, we assess for trauma and allow patients to decide when and how to address it, building trust and empowerment. We also offer a Seeking Safety Trauma Recovery Group, an evidence-based model for treating PTSD and substance abuse. Through ongoing clinician training, CRC Health ensures care is trauma-informed, patient-centered, and sensitive to individual needs. We prioritize cultural competence by understanding and respecting the cultural beliefs, values, and practices of the populations we serve, with staff from diverse backgrounds receiving ongoing training to ensure our services are sensitive to diverse community needs. Additionally, we address language barriers through interpretation and translation services, making our services accessible to individuals with limited English proficiency and ensuring that everyone can access the care they need, regardless of their language proficiency. The CTC Group's policy on cultural competency and diversity promotes sensitivity and adherence to this philosophy across all centers. Employees are required to acknowledge and sign the policy during orientation, with documentation maintained in personnel records. Each CTC develops a cultural competency plan tailored to the local demographics, addressing factors like culture, age, gender, language. The plan integrates patient data, staff experience, and community resources. Ongoing staff training fosters cultural awareness, covering aspects such as traditions, health values, and attitudes towards substance dependence and mental illness. A long read. And let me get into their other.
So they applied for SUD and harm reduction. SUD, no, neither reviewer recommended. It was $10 million. Is anything billable by Medicaid or Medicaid?
CRC offers services that are eligible for Medicaid and insurance reimbursement. They talk about how they're sensitive to record tracking as managing public funds awarded through county, state.
What?
You going somewhere?
Today? Not-
And let's go back to the project scope. They They are looking at expanding, they plan to use this funding to address health disparities and improve health equity for communities disproportionately affected by the war on drugs through several targeted initiatives, expanding access to treatment, support local social determinants of health, and increase cultural competent care and strengthen community partnerships. They do have a MAP program for the target population, and harm reduction, I'm not sure what they've offered on that. Let me see if they have it in their budget. They have harm reduction kits, which includes 2 doses of naloxone, and they are looking, they don't have a lot here. So over the 4-year period, it's about 27,000. There's no staffing on there. They look at serving 170 each year. And on there, let's jump back into the SUD treatment. They have a little more narrative here. The grant manager will coordinate all activities of the administrative functions of grant implementation and reporting. So that is part of their grant managers in the SUD treatment. They also bundle MAT rate at $268 per week, covers screening, medication, counseling, and both initial and ongoing treatment fees for uninsured or underinsured patients. This rate aligns with local Medicaid costs for those who with high copay or deductibles. CRC Health Oregon in Multnomah County serves over 1,700 patients annually, with a 10% being underinsured or uninsured. The goal is to provide and cover treatment costs for 170 patients across Belmont CTC, Downtown Portland CTC, and East Portland CTC.
Great, that is more than enough info, Kathy. So basically, yes, they can bill Medicaid. They want to provide services for underinsured and manage their grant.
Correct.
Perfect. Okay, questions for Kathy on Allied Health CRC? Thank you, Ariana, for taking Arbor House. And it looks like Daniel Garcia is up for Autistic Women and Non-Binary Network after Ariana. Go ahead, please.
Sorry, mute button. Arbor House Portland offers culturally specific and culturally responsive services to our residents who have intersectional identities, including LGBTQ, Native American, BIPOC, formerly incarcerated and first-generation American immigrants. Our program is delivered by staff who represent these same intersectional identities. They also serve human trafficking survivors. Oh, I'm sorry, I'm supposed to be reading this exactly. First-generation Americans formerly incarcerated in long-term recovery and human trafficking survivors. This has helped us respond effectively and compassionately to our residents' needs and offer culturally specific services. We know that individuals are more likely to engage in treatment when the services support and respect their culture. We also acknowledge that we cannot represent all of the identities of our multicultural residents. And we recognize that cultural context deeply influences how individuals heal. We connect residents to resources that reflect their identity and can meet their specific needs. For example, we have built a close relationship with the Puyallup tribe and partner closely to ensure our residents receive culturally specific support. Other programs that we refer our residents to receive culturally specific care include NARA, Miracles Club, True Colors Recovery, and Fourth Dimension Recovery. We regularly partner with these and other organizations in the recovery field to coordinate the care of our residents and draw on externally culturally specific resources. They do not bill Medicaid at all. They have only applied for housing. Their housing program is extremely intense. I would check the box for shelter-based or transitional because that's close to what they do, but they basically have a house where people can stay until they are recovered. And as such, they serve a small number of folks per year because it's completely wraparound.
Sorry, Anna. Awesome. Questions for her on Arbor House? Hey, Danielle, I'm gonna pitch it over to you for the Haymarket Folk Collective.
Hi, are we talking about Arbor House?
Sorry, I lost my mute button. No, well, Autistic Women and Non-Binary Network, Haymarket Folk Collective. I show you were a reviewer.
Okay, yes, I'm sorry. Yeah. So, for answer on the culture specific answer, it reads, our organization provides culture specific services to Black, Brown, Indigenous, and or transgender sex workers in Oregon. We work with an array of folks representing a diversity of lived experiences. Everyone under the LGBTQIA2S+ umbrella, disabled folks, folks who use drugs, and folks with co-occurring mental health and substance use issues. Then it says our community is one that has time and time again been disregarded and beaten down by society. So having a peer worker-run culture-specific organization for our community is quite radical. And our community members have noticed. Consider the following testimony. Oh, and then they went through a testimony. So I think that answers their question 7. And then I don't have anything else to add.
Okay, so they applied for harm reduction at $5 million. What are the services they want to offer for that? You are muted if you're trying to talk, Danielle.
No, that's right.
So what are the menu of services they are proposing for harm reduction?
For the all of them, the naloxone, syringe exchange, wound care, safer sex supplies, and I think it's clinical testing for HIV, and I believe that it was at home clinical testing.
Anything else you want to add about this applicant?
Let's see. No, that's it.
Okay, any questions for him? Morgan.
Just like really briefly, can you tell me what they do and where?
Daniel, would you like an assist from a Measure 110 teammate?
Yeah, I just have way too many things open here. So let's see. Where are they? Okay, Haymarket. Haymarket Folk Collective is a Black and Indigenous-led group of autonomous sex workers and allies who share a common vision of our label, liberated from the binds of racism, patriarchy, etc. What is your question exactly?
I'm just wondering if they describe what services they provide in what types of environments and to whom.
Yeah. They're a grassroots organization based in Portland with the mission to advocate for safer sex and more equitable home and workspaces for Black, Brown, Indigenous, and transgender sex workers. They started in June of 2020, and they have implemented over 2.6 million in grants, providing peer-delivered health education, resourcing, and advocacy specifically by, for, and with marginalized sex workers of color who have been disproportionately harmed by the war on drugs.
Thank you.
Awesome, thank you. Appreciate it. Any other questions before we move to Boulder Care? Okay. Thank you for someone picking up Boulder Care. And then queuing up Greta for Bridges Exchange after Boulder Care.
And I'll read number 7 for Boulder Care, which we've heard before. I'll try to be quick. Boulder Care is committed to providing intersectional, culturally, and linguistically specific services to patients. Boulder maintains an active organization-wide diversity, equity, and inclusion program that engages staff in ongoing discussion and educational topics, using both internal and outside expertise. Boulder is focused on a variety of issues affecting its diverse patient population, for example, anti-racism, the intersection of race and the war on drugs, language education for specific populations such as Native American, criminal justice and how it mishandles addiction, harm reduction principles. Boulder Care prioritizes a diverse care team, including clinicians and care advocates who will provide care themselves and help educate the larger care teams based on their own lived experience and unique perspective. Currently, the Boulder team is comprising of the following: 33% of clinicians and clinical support staff identify as non-white, Black, Indigenous, Hispanic, Latinx, Asian, or 2 or more races. 80% of clinicians and support staff identify as female, 20% as male. 3.6% clinicians and clinical support staff identify as LGBTQ plus or Two-Spirit.
Thank you, Kathy. And Boulder Care in Multnomah County is applying for SUD for 5.3, peer support at 350, and harm reduction at 1.1 million. I believe our summary is that Boulder Care provides telehealth to anybody who calls, and that they have clinicians and potentially integrate with local folks around harm reduction. And I think they do also some naloxone and testing trips by now. And anything else to add about peers, who I believe are also telehealth peers who are able to contact and work with clients over the phone? Anything I'm missing?
I don't think so. It's 3.5 million for their care delivery salaries under SUD treatment. And that includes, that's just for the care delivery salaries and tax and benefits. They also have a marketing expense over the 4-year period of $652,000. And their peer support, it has salaries over the 4-year period for clinical care staff of $318,000.
Okay. Any questions for Kathy about Boulder Care? And then we've got Bridges coming up with Greta. Bridges to Change. Go for it.
I'm ready. Answer 7. Bridges to Change does not provide culturally or linguistically specific services. Our partnership with Northwest Instituto Latino supports recovery housing services for the Latino community, where we collaborate with Northwest Instituto Latino as they provide culturally specific service operations. Bridges to Change provides translation services either through the individual's health insurance benefits or through contracted translation services to ensure that we can meet the needs of individuals seeking care, referrals, and coordination. Answer to whether they can Medicaid covered. Bridges for Change has been operating Medicaid billing since 2017, and they have extensive experience with billing, but many of the services that they're providing are not eligible for that. So what they're asking for is they're asking for housing support for a few different types of housing facilities, and then they embed peer services into their housing programs. And many times those peer services aren't covered under Medicaid due to the fact that they're not attached to treatment plans. So, so they are providing, if you want an idea around their housing, they are a current Measure 110 provider, but they are asking to fund, I think it's 73 beds of supportive housing and also expungement services. They have a partnership with PCC for that. So some of that cost is under their program cost for the expungement program. But they have 25 beds at a recovery access center housing center. They have a men's stabilization housing facility with 7 beds. They have treatment-specific housing with 14 beds, and they have recovery supportive housing. They have a parent and culturally specific housing partnership, which serves, it looks like 14 to 20 beds, just depending. And then again, the expungement program. So that's kind of the summary of what they're asking for.
Great, thanks, Greta. Any questions for Greta about the Bridges to Change application? Sean McMahon, you're up next with the Cascade AIDS Project.
All right, so number 7, across the agency, Cascade AIDS Project provides a wide variety of culturally and linguistically specific services for LGBTQ+ people and people living and or affected by HIV. Cascade AIDS Project provides culturally specific services navigation for Latine participants and in participation with the Urban League Black participants, and we provide bilingual Spanish and English culturally and linguistically specific housing services and peer support to people living with HIV and AIDS. For billing, yes, they can bill. They're part of the Prism Health, which can and does bill for services minus those that are not covered by Medicaid and private insurance, such as housing, case management, and peer services. Looks like their peers are both in the office and in the field. Let's see here. Housing, you got the sheltered-based transitional housing, hotel-based emergency housing, and rent assistant financial housing with permanent housing. When it comes to the harm reduction offerings, the specifics that they have are MAT, fentanyl test strips, and safe use supplies. A side note on here is that when it comes to question 7, in a different area of their application, they did state that they have not historically been able to provide consistent culturally specific peer services, with being able to offer peer services to 31 people over the course of 2023 and 2024. But they want to hire 6 more peer support providers to serve 225 individuals over 4 years. In the areas of primary care, mental health, and SED programs.
So Cascade AIDS is a current provider, and they provide assessment and SUD services. So the peer harm reduction and housing would be expanding their reach.
And I do want to point out that on the slide here, they do not show as previously funded.
Oh, good call. Thank you for catching that. They need to be orange.
There was one more thing that kind of stood out. They are wanting to hire a housing coordinator, but they have it listed as spending 2 days in Prism Health offices, 2 days in Cascade AIDS Project offices, and 1 day in remote capacity. And I was curious because I couldn't find it if both of the office spaces are within the same county, the Prism Health and the Cascade AIDS.
Yeah, I didn't see that.
Thank you. Any questions for Sean? And Stanley, you're up next with Cascadia, unless Drew joined us, which I don't think he did.
All right. Well, I'm ready to go.
Great. Hit it.
Right. Number 7. Does the organization, blah, blah, blah. Sorry, I cut and pasted the question, which I shouldn't have. I can't even pronounce stuff today. Cascadia Integrated Model of Care is unique. We are the largest provider of behavioral health services for individuals and families with SPMI in the Portland metro area. While not a culturally specific provider, Cascadia recognizes that racism, particularly anti-Black racism, is a public health crisis. Cascadia's effort to ensure that services are culturally responsive are guided by an agency-wide racial equality plan, which outlines projects in these areas: recruitment, retention, culturally sensitive, community engagement, staff development, and data. As part of our effort to ensure that our staff represents the demographic of those we serve, Cascadia Human Resource Department collects and reviews equal employment opportunity data monthly and collaborates with the EDI team to conduct initiatives to ensure the number of staff with culturally specific and linguistic skills are appropriately represented of all we serve. Among these served by Cascadia, we estimate that over 30% identify as Black, Indigenous, and people of color, BIPOC. All right. And they are able to bill Medicaid and other insurances, peers, both in the office and in the community. I couldn't really tell if they're both for SUDS and assessments, so I put office. But for harm reduction, they didn't do housing, but for harm reduction, they do both. And harm reduction, Narcan, wound care, safer sex supplies, and clinical testing. There was here it talks about syringe exchange, but it didn't really say. However, they do provide sharps containers in the communities. And so I wasn't sure if that was like connected with the yes or no box. So I just wanted to provide that information that they do provide sharps containers for community members.
Anything else, Stanley?
Pregnancy test, hygiene kits, and areas like that.
Any questions for Stanley on Cascadia's application? Morgan?
I might have missed it in the middle there, but their SUD program, what does it look like? Like, where are they getting their clients? What are they doing for the SUD treatment part of it?
Let me look. I did not put that on the little spreadsheet, so I have to dig a little bit.
I'm sorry, I'm taking notes here. I'm trying to get to high level.
No worries.
See what everybody does. And then for anyone who's coming up to bat and has an org that applied for housing, I'm trying to mark if they're the ones literally providing the housing or if it's just coordination. So I'm going to ask you that. I'm just throwing it out there.
All right, so here we are. Cascadia has been offering substance use treatment since 2002. Oh, sorry, 2002. In 2017, Cascadia began offering medication for addiction, MAT, through the addiction service line as their first in a service of systematic changes to improve addiction treatment. Offering for people. Cascadia launched the delivery of doesn't really substance treatment across lines. So it looks like it's more for their addiction service line. Low barrier counseling and psychosocial services. So they're counseling and services. Is that what you're asking, or do you want more?
That's great. Thank you.
No problem.
Awesome. Any other questions? Just a time check. We are at 9:18, about 45 minutes in. Next up is Central City. Emily.
All right. There, question 7 is long. I'm going to read the intro to it because I think that probably gives people enough information here. The proposed funding will support Puentes CCC's culturally specific program delivering bilingual, bicultural SUD and mental health services to the Latinx community in Portland metro area. CCC also operates 3 CSPs, culturally specific programs, serving Portland's Black African American communities. Though CCC began in the Old Town neighborhood, the current location of Puentes is in the East Portland area, which was chosen because CCC research showed the Latinx homeless population did not experience their homelessness in the downtown region, but in the eastern side of the city. CCC is focused strategically on meeting our clients where they are, setting no limits on where someone's journey of recovery may begin. CCC also strives to correct deficiencies in previous recovery models and historic discrimination against Black, Indigenous, and people of color in Portland by expanding culturally specific programs and actively working to become an anti-racist organization. CCC understands that simply interpreting Western style behavioral health treatment into Spanish would be setting up the program and its clients to experience many of the same cultural barriers to care and underwhelming outcomes. Rather, from the start, Puentes integrated a deep and firsthand understanding of the Latinx cultural values and how they approach and provide treatment, including, and then it goes through a list and description of those values. Just for the sake of time, not going to read through all of those, but I think the short answer here is yes, they are culturally specific program. Question number 2. They provide Medicaid eligible and Medicaid eligible primary and behavioral health care to more than 11,000 patients annually. So yes, they do provide Medicaid reimbursable services. They're not offering peer support. And I'm just going to phone any friend out there. They do have recovery mentors. I'm not totally sure that those are the same thing as peers. So I'm just, unless someone says otherwise, going to move through that section. They're not offering housing. There's really not a description for harm reduction either. So I think that's where I end.
Do they have a list of what they want to pay for on the harm reduction section of the budget?
They might. Let me get, because they of course don't have their budget open. But I'm doing that right now. Their harm reduction budget just has positions. So SUDS counselor, SUDS clinical supervisor, lead recovery mentor in their narrative. And then they have like, and the bottom category in the funding sheet, services and supplies, they have janitorial supplies, lab fees, support services and support materials.
So nothing about Narcan or anything else in the harm reduction or naloxone or wound care, hygiene supplies.
No, nothing in their budget for sure.
Any questions from anybody else? Okay. In the chat, you can see that Tatiana is up with CODA.
Good morning, everyone. For CODA, overall, really high quality, strong application. For number 7, they just had one sentence noting that they do provide a culturally linguistically specific services, but do not provide any detail on that. They do, however, in section 8, as they go through that list of kind of core competencies, do highlight it there. So just wanted to note that. In terms of core interventions, it's interesting, they were a previous funded grantee that included SUD treatment, but this time around did not propose that. And so for assessment, they're focusing on rapid next day assessment and linked to methadone MAT treatment, MAT treatment. And for peer support, a good description of how they're hoping to expand their recovery mentor workforce to address what they hope to be expanded treatment bed capacity in Multnomah County due to some of the other investments in that space. And so overall, anything else in particular you want me to highlight?
Just the typical questions about peers if they're in the office or in the community.
I will double check that, but I believe that it's out mostly street outreach and engagement into treatment. I'll double check that now, though.
All right. Any other questions from other panelists on this application for CODA? Okay. Queuing up for after Tatiana researches. Fora Health is next with Grace and Danielle.
For health, question 7.
Grace,
Oh, sorry.
Thank you. I love that you're like in it and
I'm
ready.
sorry.
Tatiana
Oh
was
my
just
gosh.
taking a quick peek to see if there's an answer about the peer support.
Got it. Okay.
Awesome.
Okay, so for health,
Oh, 1 second, Danielle. We're waiting for Tatiana to have an answer about the code of peers, and then we're gonna plow right in.
fantastic.
Laura.
Sorry about that.
Thank you. No problem.
You can tell I'm multitasking today, right?
I can. It's 4 hours. I get it.
And so just to clarify, it looks like it's both in
Okay.
office and outreach, in community outreach. So I apologize.
No problem. Thanks, Tatiana. I appreciate it. Any other questions? I don't think there were. And I will let folks know I'm trying to stay ahead, just a couple of clicks and putting who's next and who the reviewers are. So watch your name in the chat. So I'll hand it back over to Grace and Danielle to talk about Fora.
Daniel, do you want me to take this? The first couple?
Yeah. I
Okay.
mean, I can read the answer of question 7.
Okay.
It says, let's see, Fora, this organization is a culture responsive to the diverse clientele they serve. They offer linguistically specific services through Spanish-speaking groups and individual Spanish-speaking counselings at their outpatient Hillsborough location and remotely at their Cherry Blossom location. That's all what they answer for the question 7. And then for the Medicaid questions, they said that the application stated that that organization accepts most insurance providers and 90% of their patients are on OHP. They added that they have a sliding scale program for individuals based on income level and family size and have indigent funding. Let's see, organizations looking to hire 5 new FTEs composed of 2 harm reduction peers, 2 residential outpatient peers, and 1 admission outreach worker in order to expand access for SUT treatment. These positions will not be billable and will provide services to individuals without care plans or in between levels of care. Grace, you want to answer the other ones?
Yeah. So peers, right? Peer support. Is that the one?
Yes.
Okay. I believe peers are both. I saw it says peers are embedded in our residential and outpatient settings. Our proposal includes 2 vehicles to facilitate outreach services, such as giving people rights to referrals, housing resources, PCPs, and anything additional support that will help on their health journeys. So I just interpret that as both field and in person. Screening or assessment, assessments, it says funds for 1 admissions outreach worker to provide evening and weekend coverage and contact for referrals and those wishing to enter withdrawal management. Nothing for housing, nothing for harm reduction. So hopefully that helps a little bit.
Awesome. Any questions on Fora? Okay, Ariana is up for Fresh Out. Thanks for picking that up.
All right, the Fresh Out model of service was created by and for Black African Americans who have been involved in the criminal justice system and reflects our cultural values and collective identity. As formerly incarcerated African Americans in recovery, we use storytelling in our work with a historical perspective on the legal system and our lived experiences as peers who have become productive members of society. We speak to clients in a language they understand, including the use of prison jargon and street lingo, which helps build trust and mutual understanding. They offer peer support, harm reduction, housing assistance, and assistance with basic needs. None of those are Medicaid eligible or reimbursable. All services are offered at no cost, and they're a volunteer-run organization with minimal expenses. Their peers are in the field. Their housing and harm reduction programs use field peers. They offer rent assistance and financial assistance towards permanent housing. And in harm reduction, they offer naloxone wound care and clinical testing for hepatitis, HIV, syphilis, etc. There's a note that says it appears that Fresh Out's harm reduction services mostly consist of referrals and coordination. They don't distribute or naloxone or provide safe use. They simply refer out.
I'm sorry, Anna. Appreciate you picking that up. Any questions for her? You'll see from the chat, going home to is Greta and Michelle.
Hello, this is Michelle. Can you hear me okay?
Yep.
Okay, good. Number 7, this is a culturally specific provider. Going Home 2 provides culturally specific services to the Black community. 99% of our staff identify as Black and 100% of our leadership as well. Going Home 2 is a trusted resource in the Black community. Our executive director and all program managers grew up in Portland and are widely known and respected in the community. That said, we don't turn anyone seeking our services away, regardless of their race or ethnicity. Their peers, they applied for housing, peer support. They meet their target population wherever they are at, which is they're super focused on, of course, people getting out of prison or jails, preventing gun violence, women in gang culture, things like that. And I liked that they're going to meet the population wherever they are located. So definitely out in the community. And they do not bill Medicaid.
Fantastic. Thank you for that. Any questions about the peer support or housing from anybody?
I just wanted to add that so this is it seems like a pretty large ask for the peer supports, but it's due to the fact that they're expanding what they were currently doing. So they're expanding FTE and peers from the project that they're currently implementing through Measure 110.
Thank you, Greta.
I'm sorry if I missed it, but what was the type of housing?
Oh, I don't think we mentioned it. It is, let me get to that. My apologies. Let's get up here. Transitional and supportive housing for individuals with SUD. Program activities, housing screening, goal setting, except clean and sober housing and transitional and emergency housing. They'll accept all those Section 8.
And they didn't, I will say that in my write-up of them, I commented that they didn't talk a lot about in the project scope about housing. It was more geared toward their peer efforts. But I did find out in their budget worksheet that they want to sustain no-cost housing, and they have 2 homes with 10 beds each that they operate.
I had a question. I may have missed it. Did they say how many peer support specialists they're going to be bringing on for $10 million?
I have, let me find that.
They did. They're very detailed about that.
Okay, great.
Do you have that, Michelle?
I am pulling that up right now. I'm going to the increasing housing peers from 2 to 3, increased peer supports from 6 to 10, and increased case managers from 2 to 4. So basically doubling in size with peers. Does that help?
I think she said yes, thank you. You're muted, Kirsten.
Oh, yes, I said yes, thank you. To myself. Sorry about that.
No worries.
Other questions? Okay, last on this page is Haven Counseling with Hannah and John.
I can go ahead and start for Haven. Haven Counseling Collective, HCC offers addiction treatment services. They're eligible for Medicaid and mental health services. They're eligible for other, oh, sorry. Okay, stop. That's the second one. Haven Counseling Collective is a woman-owned business that was founded in 2022 to provide comprehensive adolescent, young adult mental health and substance abuse treatment outside of the traditional office setting. Her program was created in response to the lack of youth behavioral services in Multnomah County with the hope to lower barriers for vulnerable youth and fill missing care gap. It was envisioned to deliver care in a more efficient, youth-friendly, and compassionate way. The owners have expertise in providing care to adolescents with co-occurring disorders at all levels of care, including residential partial hospitalization, intensive outpatient peer support services. Several owners having lived experience of mental health challenges, substance use, and recovery. What they're asking to fund is low barrier substance use treatment, hiring clinical and administrative staff to expand the program. Currently operate with minimal capacity and small budget. Level 1 clinical services, engaging youth, hire a clinical director, continue to provide services above in year 2 and hire an additional full-time CADC, and continue to, and by year 3, hire an addiction, and 1 day per week, a medical doctor to provide psychiatric and addiction medical care, and then continue to grow the IOP. We're also asking for harm reduction service grants, harm reduction service funding, grant funding, to purchase naloxone and fentanyl test strips for distribution by our CADCs. They offer addiction treatment services that are eligible for Medicaid and mental health services that are eligible for other insurances. They have a contract with PPS that allows for the provision of services to any PPS student regardless of insurance status. HCC intends to use grant funds to identify gaps in services, expand access to existing services, to develop additional programs, train and hire clinical staff, and expand company infrastructure to ensure the longevity of the program. They're going to use the grant funds to identify these gaps in services. Well, I guess they've already done that, and they're asking for these positions essentially, to successfully reduce wait times for treatment services, referral wait times to higher or lower levels of care, and efficacy. I think they mean increase the efficacy of crisis management systems for youth, including outreach services to high schools and middle schools, and expanding community outreach to East County schools, which is not an activity that's compensated through Medicaid or other insurance programs. So essentially asking for staffing to staff up. They do, obviously, as I mentioned, they are eligible for Medicaid. Just objectively looking at this, it's a good application, but there's still a little bit of detail missing in terms of which is interesting. They have services that are eligible for Medicaid, but they don't seem to have any staff funded by that currently, or very, very limited. So it's just my observation. Other than that, that's about all. Is there any questions?
Yeah, real quick, John, they have a very small harm reduction budget for 3,000. What are they offering?
Just naloxone and fentanyl test strips. I'm gonna guess, but I'm just, from what I see, what they're saying is that the CADCs that they're hiring would be distributing that. So I'm just guessing for their clients, right? To offer that for their clients as they come to treatment services, they're going to offer them this, which is, it's a very small budget for that. So, that's not a lot of money, for naloxone, for sure.
Thanks, John. Any questions for him on this application for Haven Counseling Collective?
Thorough and informative. Thank you for pulling out concise examples from the application.
Yeah, thanks, Morgan.
Awesome. All right, we're going to page 2 of 4, and Emily is up first with Helping Hands Reentry Outreach.
Hey, okay. My internet keeps kicking me out of this meeting, so if I drop off, I will try to get back on. All right, question 7. We do not provide any specific cultural linguistic services in Multnomah County. We do partner with Linguava for all translational services. Our approach is grounded in the principles of trauma-informed care. We recognize that individuals experiencing homelessness and behavioral health issues often have histories of trauma, and our services are designed to foster a safe, supportive environment. We actively collaborate with local behavioral health providers and the diverse populations we serve, including BIPOC, plus individuals and those with disabilities. Our team is trained to implement strategies that are sensitive to cultural differences and respected. Additionally, our services are designed to meet the Americans with Disabilities Act requirements, providing accommodations to ensure accessibility for all individuals. For question 2, for Medicaid, Helping Hands and Free Outreach Services became a health-related services network, HRSN, in May 2024 and applied for community capacity building services to develop the ability to begin receiving reimbursements, but not currently. So Helping Hands is building capacity to build Medicaid and other health insurance providers, but does not yet have that ability. Okay. Their peers are associated with their housing. Their housing is emergency type housing. And so their peers are like technically in the office, which is their housing. And there's no harm reduction being requested.
Any questions? Great, thank you. June, you're up for Iron Tribe.
Yeah, so number 7 is Iron Tribe Network provides culturally and linguistically specific services to a diverse range of communities. Our programs and services are centered around trauma-informed care as we serve populations that have experienced trauma associated with substance use, mental illness, childhood abuse and neglect, intimate partner violence, sexual violence, child welfare involvement, justice system involvement, incarceration, discrimination, and oppression. We employ multiple bilingual and bicultural staff members who provide culturally specific support services such as translation and resource navigation. We ensure that our materials are available in Spanish as well as English. All of our houses are open to undocumented individuals and families. Iron Tribe Network has experience serving individuals with both physical and intellectual disabilities. In our burn homes alone, we have made several accommodations for clients with physical disabilities, intellectual disabilities, and mental health disabilities. All Iron Tribe housing is gender inclusive, which can reduce a significant barrier for trans and gender nonconforming individuals. We maintain relationships with community partners in each county who provide gender affirming care and LGBTQ I think IA2S plus specific services so that we know where to refer clients who have needs that our organization does not directly provide. Our staff members are trained on providing affirming and inclusive care to trans and gender nonconforming individuals, as well as members of the LGBTQIA2S plus community. Iron Tribe Network is a family-focused organization, so we have extensive experience providing services for parents and non-traditional parents with minor children, as well as pregnant persons. Our houses are set up to accommodate individuals and couples with children. Our burn houses have served many diverse types of families, including single mothers and fathers with children ages 0 to 17, co-parenting parents with children, pregnant persons both with or without older children, and parents in the process of reunifying with their children from ODHS custody. So hold on one second. This organization applied for peer support housing. Their peer support is mainly geared around their housing services, but they do some community outreach. So they're not just in office, they are in community. They appear to have a really good approach for assisting community members in accessing needed community resources. They are not able to bill Medicaid, and they don't bill Medicaid right now. Their housing services appears to be absence-based and does not provide a whole lot of detail around how they address continued use. They do appear to have a strong community presence. And I did note that they provide gap-filling housing needs to individuals seeking an abstinence lifestyle.
Thank you, June. Any questions on the Iron Tribe application for Multnomah County? Okay, thank you. Juntos Northwest is Grace and Ariana.
I can start number 7. Juntos Juntos Northwest is exclusively organized to offer culturally and linguistically specific services to the Latin community. Our goal is to create awareness, eliminate stigmas, and reduce barriers to services that reduce drug-related harm and promote health and well-being. Our services are open to all Latino, Latinx who are at risk of behavioral health and medical problems due to substance use. Approximately 72% of the people we have served to date identify as male, 25% as female, and the remaining 3% as non-binary, two-spirit, transgender, or questioning. Latino women and members of the LGBTQ plus community continue to encounter obstacles and stigmas. And so they do, it's a long paragraph, but in short, I think they do offer culturally and linguistically specific services. They're not Medicaid eligible nor reimbursable. I didn't see anything on peers. For housing, provide this context because it's helpful. It says, with the introduction of the new deflection program in the Multnomah County, it's crucial for Juntos Northwest to create a dedicated bilingual and bicultural Latin outreach team to support Latin individuals who end up in the deflection program. The Latin outreach team will provide navigation assistance to connect clients to detox, treatment, emergency shelter, housing, and basic needs services, including Juntos Northwest recovery housing programs and recovery support services. And then housing, Juntos Northwest currently operates Abuelos House, an 11-bed transitional recovery home for single Latino men and Latino men with children. They expect to provide transitional recovery housing and follow-up care to 22 clients annually for a total of 8+ served during the 4-year project period. And then,
Sorry.
Go ahead, Ariana.
In their harm reduction, they are offering naloxone and wound care, and I get the impression that that's primarily offered to folks in their in Abuela's house.
I'm sorry. Morgan, did you have a question?
So it was service housing navigation broadly, but they also operate a recovery home, but only for men.
Yeah, I believe, so. Yeah, I see a recovery home for single Latino men and Latino men with children.
All right, thank you.
Yeah.
Anything else to add on Juntos? No questions? Okay. Next is Juliana and Greg's report out for LifeWorks Northwest.
I've got it up, Greg. Okay, so I think they're only applying for harm reduction. Or no, they're only applying for peer support. Their answer to question 7 is all LifeWorks Northwest staff attend mini trainings on culturally responsive services addressing systemic racism and how to respond to and understand the inequities and disproportionate impact of criminalization of addiction and lack of access to services. LifeWorks Northwest has a robust system to elicit feedback from clients, direct service provider staff, and community members to determine what gaps are in the community and work to fill these gaps in the behavioral health field. LifeWorks Northwest has many years of experience working with these populations across the continuum of care we provide. However, we will also depend on our community partners to continue to improve the system of care that has historically underserved these populations because we have not been able to meet all the needs they experience. LifeWorks Northwest has 2 culturally specific services in Multnomah County that specifically serve the BIPOC community. Our Recovery, Empowerment, Achievement, and Life Real program provide culturally specific mental health, alcohol, and drug treatment for African American adolescents. Project Network is a women's residential program located in Northeast Portland, Multnomah County. This program is designed to treat Black women and women who are pregnant, parenting, or working to reunify with their children. Service delivery consists of CADC, CRM, and QMHP service provided through group and individual treatment. In addition, parenting programming is incorporated into the program, and women who are involved with ODHS in Multnomah County work with the family involvement team case manager. Frequent urinalysis testing is used as a treatment tool to monitor substance use. On-site childcare is accessible to women's children age 5 and under. School-age children 5 to 9 are transported to and from their school by mothers. This residential program provides on-site cleaning services Monday through Saturday. On-call clinician support is provided 24/7 for after-hour clinical needs. The site is staffed by a residential care facilitator staff 24/7. Project Network specifically works closely with the family involvement team collaboration to have direct and ongoing communication with various community providers that offer a variety of treatment services. Let me get to their Medicaid question. They can and do bill Medicaid for some services, but not all services they are requesting funding for are covered by Medicaid or M110, such as outreach and case management for transition services. Funding would be used for these activities. They have, sorry, my answer is so big, it's taking up my whole Excel cell. Applicants plan to use funding to hire peer support specialists at their outpatient location and provide peer support programs for women transitioning out of a residential treatment setting to outpatient care. This would involve group skill building, employment counseling, some case management activities, and peer support. We also answered that they're culturally specific. They're not applying to any other service area other than peer support. Did I miss anything? I think that's it.
I would just add that their peer support is exclusively office-based.
Yeah, it's at their outpatient location.
Oh, okay. Sorry, I missed that. I'm Greg today, by the way. This is Ariana.
Oh, I see.
Any questions for Greg or Juliana? All right, next up is Lutheran Community Services Northwest, which is June and Crown.
I can read number 7. LCSNW serves more than 5,000 individuals each year, of whom over 70% are immigrants or refugees. In Multnomah County, we have served refugee and immigrant communities for 50 years, providing refugee resettlement and wraparound services that respond to the unique needs and challenges facing these communities with cultural and linguistic for 760 individuals in Multnomah County, including refugees, immigrants, and other marginalized individuals dealing with SUD. This one was one of the first ones I did, so I don't really have it memorized, right? So I have to actually go back through here. And they are doing screening, assessments, SUD, and peer support. They are able to bill for their services. But they say that they're not going to supplant the services that they plan on providing will not be billable services. Their SUD treatment let me go back here and look. I'm sorry, you guys, I don't have
I
this
can,
one.
Gina,
Yeah, go ahead.
I can
Yes.
chime in about they are a Medicaid billing eligible agency, but many of the services, because of the specific populations, won't be eligible for Medicaid because of the size of groups that they won't be able to obtain. The application didn't really touch a whole lot on all these different areas in great detail, but it is a very diverse and large population that they're serving. I wrote that my concern is, and this isn't really something that they can do anything about, is with such a diverse population of different ethnicity and languages, it's hard to find people to serve that population, professionals, and train them. And so that was kind of my concern, because they looked like they're having a little difficulty spending up their current Measure 110 money. And I think their plan is great. It's just a matter of, can they locate the resources of people they need to serve this population to expand their workforce. That's just one of my comments.
Yeah, in their sub-program, it says that LCSNW objectives also include deploying contingency management programming for said base on our comparative analysis surrounding effectiveness on substance-specific programming. They want to expand their peer-delivered services, which really, the impression I got from their application is that peer support is the foundation of their services. And so they're wanting to expand on that to reach these marginalized populations.
Thank you. And that was everything. No housing or harm reduction. Any questions? Okay. MHAO is next with Liz and Hannah. Mental Health and Addiction Association of Oregon.
I guess I can take it.
Well,
Question 7. MHAO is deeply committed to providing culturally and linguistically specific services that are tailored to meet the unique needs of diverse communities across Oregon. As a peer-run organization, we prioritize the voices and experiences of those we serve, understanding that everyone's recovery journey is personal and profoundly influenced by their cultural and linguistic background. Our dedication to cultural responsiveness is central to our mission and is integrated into every aspect of our work, from direct peer support services to community collaboration, education, and advocacy. Through the BURN program, we ensure that our peers offer culturally and linguistically appropriate services. Our Measure 110 BURN funded Latino PWS team is composed of individuals who come directly from the communities they served. We will be subcontracting with Northwest Instituto Latino in this effort to ensure we are delivering culturally specific services to a community that is in high need of them. This partnership will enhance our cultural responsiveness through collaborative supervision efforts. We recognize that one size does not fit all when it comes to culturally specific services. If we do not have an in-house program that is the best fit for an individual's cultural linguistic needs, we make it a priority to connect them with a trusted community partner who can provide the most appropriate care. This approach ensures that no one is left without the culturally relevant support they need on their path to recovery. MHAAO's philosophy of honoring lived experience and promoting self-directed recovery aligns directly with the values and purpose of Measure 110, allowing us to serve and empower diverse communities throughout Oregon. None of their services are Medicaid billable. Their peers are both in the office and field. Same applies for their screening and assessment services. And as far as harm reduction goes, they do naloxone, wound care, and safer sex supplies.
Awesome, Liz. Any questions for her? All right, Kirsten and Nicole, Metro Plus Association of Addiction Care Counselors, who are applying just for peer support. And after them will be Miracles.
All right.
Who is Ane and June.
All right, as you said, Metro Plus is applying only for the one category. Their answer to question 7 is MAAPPS works closely with the African American community, the Latinx community, the Native community, LGBTQ2SIA+, and youth peer services community. Close partners in Multnomah County include Miracles Club, Painted Horse, Juntos, NWIL, True Colors, and Fourth Dimension. They are only doing the supported employment, so Medicaid billing is not relevant. It's hard to answer the question of peers in field or in office because this is a peer technical assistance program. So it is a previously funded program, and they have 3 primary elements: an outreach coordinator to engage communities of color and sexual minority communities and to recruit peers of diverse cultures into Oregon's peer workforce. They provide scholarships to 595 peer applicants so that those peers can get their certification. They provide core Spanish language CADC trainings to 62 Latino peers. So how are peers integrated into other services? It's only supported employment. Housing is not applicable. Harm reduction, not applicable.
That was a wonderful summary, Nicole. Thank you. I would just add, I think it is a very unique program that really supports the advancement of peer support specialists across Oregon. And yeah, so. Any questions?
Great. Thank you both. Anne and June, you are up for Miracles.
I can read number 7. The Miracles Club is a Black peer-led recovery center committed to providing safe spaces for marginalized, historically oppressed racial and ethnic groups. We are rooted in the African American culture and community and serve all looking to reduce harm from alcohol and drug Hispanic community and culturally specific services for the LGBTQIA2S plus community. This organization is applying for peer support, harm reduction, housing. They do not bill Medicaid currently, and these services, they just wrote on their fiscal narrative that they don't bill. Let's see. I did know their ask is really, really large for all of these service areas. And there are some major line items in their budget that could be taken out to reduce their ask pretty easily. Their peer support is out in the community. It's also in their brick and mortar. They do serve a marginalized group of individuals. With these funds for harm reduction, they plan to, they do provide a full spectrum harm reduction service, and they want to expand their days a week that they provide these services. Currently, I believe they're providing I can't remember how many days a week, but it's not 7. They want to expand to 7 days a week. And their housing program, they have 2 houses their housing program, it says, has 2 houses. One will serve men and one will serve women, and one they have 2. I must have wrote this all wrong. They want to expand from 3 to 5 houses. Their housing is recovery housing and requires abstinence. But this organization does have a plan for individuals who do continued use. They don't offer housing to individuals who continue to use, but state that their goal is to create safe environments for their clients. They treat return to use on an individualized basis. And I think that's it. Did I miss anything? I'm sure I did.
Question.
Yeah.
Isn't Miracles a currently funded org?
I'm not sure if they are in this county. They made it sound like they are.
I will double check.
They are.
There.
I am not sure how that, I will fix it.
Here,
I know we're trying to hurry, but I do want to say something. This application was exceptional. Like they're really out there doing the deal. So I just wanted to say that the application looked really great.
So, thank you so much for that summary.
Great. Thank you. And next up, unless there's other questions, and Ariana, if you want to, oh, you're up next. Never mind. When you want me to refresh to fix the coloring, I'll be in there. So, but Morrison Center is Juliana and Ariana.
Sorry, I was talking before I unmuted. I have Morrison Center up.
Okay, go ahead.
They're actually called Morrison Childhood Family, and they have a parent mentor program. Takes active steps to assure that parents' language needs are met. Given that the Latinx community is the largest community of color in Oregon and the Portland metropolitan area, the program has incorporated bilingual and bicultural Spanish speaking Latinx mentors in each county we serve and pays a wage differential for bilingual staff. We also added supervisor positions to include bilingual, bicultural, Spanish-speaking peer supervisors. Likewise, we have developed program materials such as informed consents and releases of information professionally translated into Spanish so that parents can fully understand and participate in mentoring services. None of their peer services bill Medicaid, and peer mentors are not credentialed. Peers are in the office exclusively. And I believe they only applied for peer and program costs. Yes.
Morgan?
Does their application, and if you don't know this, we can just skip it, but mention other streams of funding? Because when I hear what they do, it feels like it would maybe be funded elsewhere. Am I mistaken?
I'm not sure I caught that.
It's just
They in their answer to question 4 about funding sustainability, they do talk about having diverse funding streams, grant seeking. They have contracts with other agencies such as ODHS and HealthShare. They plan to utilize data to further demonstrate needs for funding. And they, for their question whether they, for their question on whether or not these funds would supplant Measure 110, they did note that the services can't be paid for by Medicaid, but didn't describe how they wouldn't supplant Measure 110 covered services. But what they are applying for isn't paid for by Medicaid.
Thank you.
Okay. Any other questions? Oh, and I forgot to put the next reviewer in. That is my fault. Mountain View Recovery, doing business as Knapp Street Recovery. And that is June again, and Mark.
I know I have a lot today. I was just reading up on this one to kind of get up to date. Okay, number 7. MVR provides culturally and linguistically specific services, primarily serving the Latinx community and Indigenous communities. Currently, MVR has a house with several Spanish-speaking only tenants and a bilingual assistant manager who assists with translating house matters and providing support to residents. This ensures that Spanish-speaking clients can effectively communicate their needs and receive culturally relevant support. Additionally, MVR partners with the Native American Rehabilitation Association, NARA, to support Indigenous communities. Through this partnership, NVR collaborates with NARA counselors to offer housing and recovery services to Indigenous clients, or ensuring that they receive culturally appropriate care throughout their recovery journey. These efforts demonstrate NVR's commitment to reducing barriers and providing access to recovery for these underserved communities. They're applying for peer support and housing. They do not bill Medicaid. And in the future would like to, but they don't right now. Their peer support does not appear to be out in community. This peer support is in their housing, within their housing program, supporting people within their housing. Part of their housing, their scope would be, hold on one second. The organization has 75 beds across 5 recovery homes in Multnomah County, including gender-specific, co-ed, and family-friendly housing options. These homes are designed to support individuals at various stages of recovery. And I think that's it.
Any questions? Anything else to add? Thanks, June. Next up, Multnomah County Health Department, it's Kirsten.
Hi. All right. So since I'm the only one, this may be a bit of a group effort, so I appreciate everybody's help on this. So Multnomah County is applying for 3 service areas, which are screening, assessment, and peer counseling. The answer to number 7, Multnomah County Health Department and the Deflection Program serve all people living in Multnomah County. However, MCHD recognizes the importance of culturally and linguistically specific services and employs many staff with cultural or linguistic knowledge, skills, and abilities. Designations mean they are persons who identify and have skills that are specific to a cultural and or language not represented by the white dominant culture. Staff with KSAs receive premium pay, not minimum pay, premium pay for their expertise. PATH, for example, includes staff with Latin, African American, and LGBTQAI plus and plus KSAs. The Deflection Program takes client preference for culturally and linguistically specific services to account when assessing appropriate services and refers clients to such services whenever possible. The Deflection Program directly incorporates this experience and will have, this is for the next question around trauma-informed, culturally and linguistically specific services, culturally and linguistic responsive, and individuals with intellectual and developmental disabilities. So then as far as the peer supports, the program, let's see, grant-funded peers, sorry. Grant-funded peers will provide ongoing peer counseling and support to individuals participating in the deflection, whether they receive their initial deflection screening from a peer in the field or by CCPC. Individuals assessing other services at the CCC but not participating in the deflection, and other individuals at risk of law enforcement interaction for deflection prevention. Deflection is considered complete if the individual engages in a referred service based on their screening within 30 days. So it does say that the peers are in the field and that they, let's see, grant-funded peers will provide ongoing peer counseling to support, basically for individuals participating in the Deflection Center. So each of the The additional funding will, each of the 5 peers will be able to support 15 to 20 individuals. So they're hiring 5 new peer support specialists with recovery support services at any given time, totaling 500 clients in year 1 and 1,000 clients in each year in years 2 to 4. Billable by Medicaid. Multnomah County can bill Medicaid, but not for pre-service, not for these pre-services. And there's no housing, so got that. Don't have to worry about that one, Morgan. And what other questions? I forget the other ones.
That's it. You got
I
it.
do. Okay.
Yep.
Yeah.
Any questions for Kirsten about this application?
No, I just noticed though in their budget they have naloxone in there. They're not signed up for harm reduction, but they have peer specialists to distribute during field-based peer support and outreach. And that equals 35,000 per year. So 35,000 times 4, 140,000.
Thanks, Kathy. Morgan?
Other than that vague statement about also engaging people who are at risk for engagement in deflection, does the entirety of their application for peers pivot around deflection and those who are participating in it?
Let's see. So it says the deflection center. So as far as this gets to it a little bit, provide services outside business hours. The deflection center will be open 24-hour facility once open. The outreach peers will be available from 8 a.m. to 8 p.m. This was one where I scored a little bit lower on this because it said if the arrest occurs outside of these hours, the individual may go to jail and will meet a peer staff at the court hearing. And it's not clear why a peer could not meet an individual while incarcerated to provide supportive services at that time. So that was one question that I had. So I'm sure there's other people on this call that know much more about it than I do, but yeah, it appears that the primary focus of the peers is surrounding the deflection center.
Thank you so much. More than sufficient answer to my question. I'm sorry.
Yeah, it does sound more like a deflection program than it does for anything else, because in their program budget they have 1.6% of it goes to a county attorney. So yeah, their funding is a little.
But it does say, so the one thing I thought under the outreach strategies, the primary outreach support is field-based outreach by peer support specialists. This will occur at the time of an individual is being arrested for field-based deflection. Peers will meet individuals wherever they are, and arrive while they are still with the arresting officer. Appeals will begin meaningful engagement at this point, taking the individual somewhere comfortable to talk and understand the individual's needs and interests, and service engagement. Together, the peer and client will begin care planning, determine appropriate referral paths, identify any current referral openings. If an appropriate opening is available and the individual is willing, the immediate transportation will be provided to the service, to that service. So it seems like kind of an intervention service.
Yeah, well, it's deflection. If there's a peer on site within whatever the time frame they decided on, then they can be deflected instead of going to jail. And if the peer doesn't show up on site, then they go to jail. But that still means people are having to pass through police contact to access this service. So it's not effectively available to the public. So thank you so much.
Interesting. Okay. And Multnomah County Health Department is huge, right? So I imagine this is a very focused program that they're offering. All right. Well, thank you. No other questions?
Any other questions? While Elizabeth gets herself ready to report on our Northwest. Right, Elizabeth, take it away.
Sorry, that took forever to find mute.
And the rest can be summary statements.
Okay, let me pull that up then. All right, for question 7. NARA Northwest provides culturally and linguistically specific services to the AI/AN community, in addition to anyone else in need. Our client population includes many historically marginalized demographic groups, and NARA Northwest is continually elevating and adapting our practices to remove barriers and improve access to our programs/services. This includes adhering to the National Culturally and Linguistically Appropriate Services (NCLAS) standards. So that's their answer to question 7. I thought that they were very explicit in identifying the community that they were going to serve, and that they demonstrated a structured approach to the cultural service delivery through the NCLAS standards adherence, and that they're committing to ongoing evaluation and adaptation of services to meet community needs. Some of the weaknesses that I saw in that, though, is that they did lack specific details on linguistically specific services, such as interpreter use or bilingual staffing, and they don't really specify how the adherence to the NCLS standards is operationalized in their practice. Do you want me to move to the next question? Okay, it's question 8, yeah?
No.
No?
So in Aria's little cheat sheet, right, you've got question 7. And the next question is if they're applying for SUD, is it Medicaid billable? And they are not. So for peer support, the question is, are they in the field or are they in the office?
Oh, I see. Okay, we changed it up. Okay. So for their mobile outreach services, it looks like they're a bit of a hybrid model. They're blending both mobile and in-office services to maximize accessibility. Their mobile outreach is focusing on screening, harm reduction, and connecting unhoused individuals to services, and their in-office services provide structured, ongoing care for clients engaged in treatment. In terms of the mobile outreach, they're doing monthly mobile outreach events across the Portland area. The events focus on reaching unhoused individuals and other marginalized populations by setting up temporary screening sites, providing food, and addressing immediate needs such as shelter or harm reduction services. They're also doing street-based STI testing and harm reduction. That's included in the monthly street outreach services. They're going to community events like powwows and street outreach efforts. They also have the cell phone and virtual connectivity support where they distribute the prepaid cell phones and portable chargers at mobile outreach events as well. And then they're doing a workforce expansion on their mobile services. So they want to hire some CRMs and peer support specialists who will participate in the mobile outreach services and help do the individual screenings for SUD treatment, housing, and peer support.
So Elizabeth, their housing ask is $2.2 million. Is it transitional housing, shelter, rental assistance? What's the offer?
That is a good question. Let me pull up their budget. So their housing, I'll be honest, it did confuse me a bit. So one of the things about NARA's application that I wanted to throw out is that the one service area they did not apply for was substance use treatment, yet they do have a substance use treatment budget of approximately $426,000 and $231. And within that budget, there are some rent and building and occupancy line items. And their rent and building occupancy line items seem to go across all of their service areas. So I just wanted to kind of highlight that for the group in relation to housing, that they seem to be spanning that particular billing line item across all service areas. In terms of what they want to bill more specifically in their housing, they want to bill for client assistance for permanent and supportive housing, flexible funds, the Oxford Recovery House housing, and then they want to do rapid rehousing client assistance. So it looks to me like it's like they're doing a little bit of everything. Like they have some permanent supportive housing, but then they also have resources for outpatient program participants, like getting assistance to stay in a hotel. So they're kind of spanning across multiple housing service areas.
Great. And you touched a bit on harm reduction. Was there anything else in the budget that was part of their menu?
Yeah, so their harm reduction budget, that is a little robust, and I might just be lacking program knowledge in terms of what it costs. But one of the things that caught my eye was that they do have naloxone kits for about 286 grand, so about $71,000 a year. And they plan to distribute about 900 kits annually. They also want to charge for wound care kits, medical supplies at about 12,000, so 3 grand a year. Then they want to do the drug deactivation kits at about 312 bucks a year, so that's not a huge expense, 1,200 some odd dollars in total. And then they do want to do hygiene kits, and then they have a line item for $36,000 for tabling supplies for harm reduction events. And I think that would cover materials for community outreach and harm reduction awareness, but it's not really clear if it's an actual supply. And then they want to spend about $22,000 just on flyers for the hotline advertising. So it's $7,000 in year one and $5,000 for every year thereafter. And that would just support their public awareness, but it's not like attached to a direct service deliverable pertaining to harm reduction.
Yep. Okay. That's great. Any questions about what she's reported so far?
Just the housing. I didn't actually hear that they have any of their own housing. I heard rapid rehousing grants and vouchers and navigation, but I didn't hear that they're operating beds for people to sleep in, correct?
I don't think so. Granted, like June, this was one of the ones I did back in December. So let me just double check before I step in it. 1 second here.
I was trying to pay super close attention when you read everything off and I didn't hear it, so.
No worries.
I was trying to make sure I understand in my brain which applicants are, because it gets so fuzzy.
Yes,
With all
yes.
the different types of housing.
Let me read what they wrote specifically. That might help give more clarity. So they said transitional and supportive housing efforts will focus on helping clients obtain emergency housing to bridge the gap between seeking services and seeking long-term housing or placement at a detox facility. Many of our clients who graduate from our adult residential program have urgent housing needs to support them through their recovery, with many Portland area shelters at capacity and high barriers for clients to access flex funds, which require enrollees to provide information that is not easily available to those in recovery. Many are left with no option for housing. Funds from this grant will be used to develop an internal long-term rent assistance program to better support clients enrolled in our outpatient program who face barriers to accessing permanent supportive housing through the coordinated entry system. This program will be modeled after our Successful Elders Regional Long-Term Rent Assistance RLRA program. We will also offer rental assistance in the form of wraparound services and flexible client assistance to address barriers to housing, such as application fees, completing ID applications, or affording rent at recovery housing. For our clients who need immediate emergency housing, we will provide short-term stays at hotels or emergency beds at recovery houses to keep them housed until spots open at detox or residential facilities. It's not clear to me because they say they have an adult residential program, but it sounds like these funds are more about getting their graduates ongoing housing beyond their program. That's kind of how I'm hearing it.
Yeah, they have beds for people to sleep in while they're in residential treatment, and then afterwards they do all of those things that you just listed to make sure that they don't end up.
Correct. Yeah,
Okay.
so I think they do it, but I don't think they're billing us for their beds.
Thank you so much.
Yes.
All right. Any other questions? And next is Bart for New Avenues for Youth.
Okay, yeah, New Avenues for Youth. For the answer to question number 7, New Avenues is home to two culturally specific programs supporting LGBTQIA2S plus youth, the Sexual and Gender Minority Youth Resource Center, which serves youth in Multnomah County, and the Living Room, which serves youth in Clackamas County. Our substance use treatment and recovery team has culturally specific roles, including PSS and CADC, LGBTQIA2S plus and BIPOC specialists. Our New Day program for youth experiencing sex trafficking and the ALDA Collective, described further in this next response, also have BIPOC and LGBTQIA2S plus specialists. New Avenues contracts with IRCO to provide telelanguage services. We also prioritize hiring bilingual staff throughout our programs to provide linguistically specific services to youth. We have formal partnerships with organizations including Latino Network and El Programa Hispano Católico, NAYA, IRCO, a range of communities, SEI, African American Youth, and other culturally specific providers. They do not bill Medicaid. For their peer support, their scope of work that's harm reduction. For peer support, that includes salary for intake and outreach coordinator, 6 peer support specialists. That includes taxes, health insurance, all the rest of that compensation, staff training, and occupancy, utilities, etc. for a place, computer, hardware, software, client incentives for participation in the program, food supplies, and other costs. For harm reduction, that also includes staff salaries for intake outreach coordinators, peer support specialists, and a mental health therapist. It also includes personnel and staff training, occupancy, utilities, hardware, software. It also includes naloxone and other harm reduction supplies. And they went into kind of more detail in their another part of the application, which was their harm reduction approach includes 2 co-occurring components. Number 1, helping young people feel immediately seen and validated to build trust, increase motivation, and drive toward health and well-being. And 2, providing young people with non-judgmental education, counseling, and support aimed at preventing, introducing harmful activities and behaviors. And anyway, there's a big paragraph on that if you want more information.
Thanks for the report, Mark. Any questions about New Avenues for Youth?
I also reviewed this one, and their peers do seem to be integrated into their harm reduction and substance use treatment. And I did want to note that they have, hold on. Their harm reduction had a really unique aspect to it. And I think, I'm sorry, Mark, if you already said they have, the naloxone, drug testing, STI prevention education, but they also offer harm reduction focused on fetal health for pregnant participants, which I don't think I have heard of yet at these panels or read in the application. So I just wanted to call that out as a unique harm reduction service they offer.
Yeah, thanks, Juliana.
Any questions for Juliana or Mark? Thanks for pitching in, Juliana. Sorry, didn't know this one was assigned to you. Great. Last provider on page 2 is Northwest Family Services, Greta.
Okay. Question 7. Northwest Family Services operates an open door policy where clients may re-engage with services as needed. Wait a minute. They have these mislabeled. So let me read this question to you. Wait, let me read. So what is the question that we're supposed to be addressing, number 7 usually? Read
Culturally
it.
specific services.
What was that? Culturally specific services?
Right.
I'm so sorry. I am. I thought I was prepared. I'm so sorry. They are out of order here. And outreach, list of experience, dressing. I am not sure they addressed that question.
Why don't you go into the answers about Medicaid and peer supports?
So
and
sorry,
harm
I
reduction and-
was totally prepared, I thought.
Yeah.
Okay, so Medicaid eligible services. I want to read this one to you because I think they are asking for a large sum of money, and I am concerned about how they if they're getting if so they are they offer services that are eligible for Medicaid reimbursement, including the newly released SRSN supports. Medicaid reimbursement services that they offer include outpatient mental health substance use treatment, including intensive outpatient care. This also includes peer support, recovery, certified recovery, and groups. The Measure 110 funding does not supplant any services that are reimbursed. Medicaid dollars are to augment any Measure 110 services. The work that is going to be done is inherently inefficient as much as it is mobile and community-based rather than clinic-based to accommodate those with barriers. So I just wanted to lay that out. And they also said virtually all their staff included in their budget are only partially funded to make up for the gaps that enable services to be fully available. In other words, if you look at the budget, virtually all the clinician and peer support specialists are listed as part-time with the expectation that the remainder of their wage will be covered by Medicaid reimbursement. So they are currently doing services for adults and youth, outpatient, and also adult IOP, intensive outpatient. So what they're wanting to do with this application is expand to youth IOP and also outpatient and IOP services for the Latinx population. I will say that they are asking for peer services. They do actually have some funding in the budget workshop for peer services, but it didn't transfer down to the bottom. And when I look at it now, I am the person who didn't recommend harm reduction to be covered by this because when I was reading their application, they rarely mentioned harm reduction. They just said support harm reduction and it didn't explain what harm reduction would look like. But now that I'm looking at this in the budget, because I didn't notice this when I reviewed, most of their peer support services are under the harm reduction category. And I do think their peer services are super important. They are out in the Gresham area where they just opened a new office. So they're focusing efforts in that underserved area. And they are planning to hire staffing, most of staffing that is bilingual, and looking for a bilingual recovery mentor and a couple youth support specialist to do that work. So I would just wanted to call that out that I probably now would recommend harm reduction because it covers the peer services.
Thanks for the clarification. I pulled up their project scope and you're right, it's hard to discern. And culturally responsive and culturally specific isn't mentioned anywhere. And I will share that they're working with these Multnomah County schools with existing partnerships embedded in a community-based setting in Gresham, actively work with Latinx Multnomah County Behavioral Health Resource Network partners and Multnomah County Behavioral Health and the Deflection Program, all existing and evolving partnerships. Northwest Family Services has made a considerable investment in diversity, equity, inclusion, training, and development. There's always be a work in progress. However, we strive to have a work environment that reflects our values. So, and then they say in the list of experience providing any of the following culturally and linguistically specific services is listed along with many others. So, that's what we got on the application. Dharma?
Yeah, this reflected my concerns with them on their other application because they copied and pasted a lot of it to their other application too, where it really didn't feel like it was addressing culturally and linguistically specific services. And it felt like it was maybe, and that was really concerning to me.
Well, can't speak to the copy and pasting. I felt the application was kind of specific to this area because they're really focusing in the Eastern Multnomah County area and the Latin population along with youth services. So there is some specific service. They didn't answer question number 7 and as a whole, but they have some specific services addressed in their application very well.
Thank you, thank you. If there's nothing else, we're going to move on to page 3. Northwest Instituto Latino de Adicciones, and I need my list, but I'm wondering if folks want to take like a 3-minute break, just stand up and stretch. Great. So it is 10:41. We are going to start back promptly at 10:45 in 4 minutes.
Carly, if I have to leave, will you still have quorum?
Yes, we will.
All right, just message me if you need me to hop back on.
Okay, thank you so much.
All right, bye-bye.
That goes for me too. Thank you, Amy.
Okay, we're back. It is time to roll. You are muted, Kathy, but you are next.
I believe it's me and Elizabeth was going to do some reading.
Oh, great.
I feel like Kathy has been doing a lot of talking and reading lately, so
It says
Okay.
unassigned, so I wasn't sure who else was on there.
I'm okay with being unassigned. We made it. Um okay, so number 7, they said NWIL is currently the only provider of culturally and linguistically specific recovery drop-in centers for Latinos in the state of Oregon. This summer, the Washington County Office of Equity, Inclusion, and Community Engagement approved and certified NWIL El Jardín as a culturally specific organization. Although we provide services for all self-identified Latinos, we specialize in serving monolingual Spanish speakers and Latinos that are categorically ineligible for social safety nets and Medicaid undocumented persons. Because we are an organization that is operated by and for Latinos, we understand that there is no one monolithic Latino community. As such, within our services, we prioritize intersectional identity within the Latino community by providing culturally and linguistically specific services for LGBTQ plus Latino clients, elderly Latinos, second and third generational Latinos who struggle with imposter syndrome and acculturation stress, Latinos facing immigration challenges, and Latinos struggling with co-occurring disorders. So I feel like it was very clear that they were culturally and linguistically focused and that they recognize systemic barriers for Latinos in recovery and that they established
And harm reduction.
Yes.
The harm reduction, or not the harm reduction, but the peer services, they do have a recovery drop-in center. So I figure like it's in the community. Do you have anything else to add on that one?
Yeah. I guess it's not specific to peer per se, but I feel like peer and harm are really integrated. They do have a lot of mobile outreach components, so I feel like that's worth throwing out there. Like they're going to rent a vehicle where they will be meeting people where they are and providing safe use education and distributing the harm reduction supplies. And then they also do street-based peer engagement. So with their peer support and case management teams, they conduct outreach beyond the office, helping clients navigate services and access resources.
They
Let's
have
see.
1.4 million in their proposed budget for recovery mentors. It doesn't say how many, but that's most of their peer is for their recovery mentors and their PSS.
Yeah, and they do work with Save Lives Oregon, so they would not be charging us at all for Narcan or for needles. The $18,000 request is for hygiene kits and the vehicle rental. So it's not, they're not duplicating resources, they're not double dipping in any funds. And I believe that the van is how they're doing most of their outreach and transportation of the harm reduction staff and supplies. And I felt like their supplemental vehicle rental cost was pretty $2,000 a year for fuel. I thought that was very reasonable as well.
Very reasonable, yeah.
Yeah.
Thank you both. Anything else you want to add before we open up for questions?
Not that I can think of.
Okay. Questions for Kathy or Elizabeth? Okay. Northwest Treatment, we have both Nicole's, Egler and Corbin.
I'm just opening it. Okay, I'm ready unless other Nicole wants to start. Okay. Oh,
Nicole, go ahead, other Nicole, and I'm here to back up.
okay. Um, okay, answer to question number 7. Northwest Treatment is a culturally and linguistically specific behavioral health organization and has been since April of 2023 for our work with the 2S LGBTQIA plus community by structuring our services and programs to better assist individuals dealing with gender identity and sexual affectional orientations, as well as aspects of the 2S LGBTQIA plus community. We have been able to both tailor our offered services to the specialized needs of this population, as well as taking an intersectional approach to all parts of our behavioral health network. Next, about Medicaid. Yes, their services are eligible for Medicaid reimbursement and they do bill insurance. Yes, they will not supplant Measure 110 because the particular activities that they're asking to fund, such as a lending library, expansion of staff, and contingency management program are not covered by insurance. It is important to note that they also offer telehealth options. I'm not sure in what. I don't know if the peers are on telehealth or if the mental health. I'm not sure what they mean by that, but they do have telehealth options, and their peers are both in the field and in the office. Then the only other thing to note is it does seem like overall, I would say this org has a lot of history and expertise with SUD treatment, given that they receive many referrals from the court for DUIs and drug use. Their fund ask seems modest and reasonable and sustainable. I also appreciate some of their unique approaches, like having a lending library and their contingency management programs. Okay. Nicole, anything to add?
Yeah, I would point out that for contingency management, the actual therapy is billable to Medicaid, but the incentives are not. So I interpret their budget as that they would use the Measure 110 dollars for the pieces of that work that is not covered by Medicaid. Their telehealth, I didn't see that it was peer services, but I do think that it is their interdisciplinary, their multidisciplinary SUD team provides telehealth treatment.
And based on their budget, they're only applying for about $300,000 for SUD, but nothing else. Okay. All right. Any questions? Okay, you guys are up next for Oregon Change Clinic.
All right, I'll go first this time since
Okay.
other.
And Corbin, you sound a little distant, your audio. So I know you're talking
Out. Can you hear me?
enough. Just
Okay.
got to focus on you. Yeah.
All right. Answer to question number 7 for Oregon Change Clinic. We are on Oregon Change Clinic. Yes. Okay. OCC services are primarily designed for the Black African American community, especially veterans and those who are recently incarcerated. We provide culturally specific and culturally responsive services in several ways. For example, we know that faith and/or spirituality are important to many people of color. We often hear the people we serve referencing a spiritual entity, and we mirror the language they use as a way of supporting them and connecting with them authentically, well beyond a dominant culture clinical approach that often sees the illness without seeing the person. We honor cultural celebrations, bringing that into our relationship building and often bringing in respected leaders and elders to promote community connections. These connections and bonds form a strong safety net that we build from in our clinical work. These connections help us build trust with clients, and trusting clients are more likely to be successful. Oregon Change Clinic does provide treatment services that are eligible for Medicaid and other health reimbursements. While not all of their services can be billed through insurance due to the specialized level of care they offer, they are experienced in billing Medicaid for eligible services, and they have a structure set up to ensure that the Measure 110 funds would not supplant Medicaid services. They do have peers who are both in the field and in the office. The peers are integrated into their other services because they are part of the multidisciplinary team that is providing substance use disorder services. The housing that they offer is temporary housing for individuals who are experiencing substance use disorder or mental health disorders or both. Their harm reduction is, I'm quoting, OCC embraces harm reduction approaches alongside treatment approaches in a manner that is well coordinated and grounded in the idea of meeting people where they're at with dignity and respect. They have two approaches to harm reduction services. The first is contingency management using incentives, and the second is health and wellness programming that addresses both mental and physical well-being using education. I didn't see any explicit harm reduction interventions like naloxone distribution or safer use supplies or that sort of thing. I don't know, Nicole, if you saw any more in the harm reduction than I did.
No, there wasn't, but they just seemed like they tried to focus more on physical and mental well-being. And that was nice. They offered like yoga classes and things like that, and like meditation. So they had some unique features like that. And then they also have, contingency management. And then they had this unique treatment called transcranial magnetic stimulation for co-occurring disorders.
Thank you, Nicole. Any questions? And OHSU is next with Elizabeth.
I am pulling that up. I'm not going to lie to you. I didn't see my name on that for today. So let me pull that all up. 1 second here. I apologize. Okay, opening up their application to get to question 7. Okay, so for question 7, it says NA. That's a strong start. And then in terms of the actual services that they're applying for that I could speak to, they're doing screening, SUD, harm reduction services.
Hey,
Okay.
Elizabeth, why don't you look for the harm reduction menu? I got the SUD covered. I pulled up their technical narrative. Okay.
Yeah.
So of course, OHSU can bill as a large medical institution, but their answer about not using Measure 110 funds is that Measure 110 funds will be applied to support areas that either do not generate insurance reimbursement or for which reimbursement does not cover the total cost of the service being offered. And they would include the grant funding to use for, in terms of this and screening, contingency management, HIV and harm reduction nurse role in the internal medicine clinic, 2 community health workers, and an addiction medicine provider is able to bill addiction medicine clinic visits. However, the reimbursement is after the fact, will not cover the cost. So the Measure 110 funds will support additional time for providers. And finally, there is a grant support person that they're hoping to cover. Do you have the harm reduction menu?
I think I do. I think I have a good idea of it at least. So what they stated in terms of their current service areas provided under harm reduction, ACP clinic emphasizes safe drug use patterns if patients are unable to abstain from substances. Naloxone co-prescribing to all patients prescribed opioids. Naloxone co-prescribing to all patients prescribed opioids or have opioid use disorder, safe opioid prescribing policies and treatment guidelines to reduce harm of prescribed opioids, and identification of OUD. In terms of how they would expand, they're looking to specifically get an HIV harm reduction RN that would provide patient-centered, patient-directed harm reduction education, such as counseling regarding safer injection, overdose prevention, and serve as an SUD and harm reduction expert for clinic staff and nurses. Additionally, the RN will provide care coordination for patients living with HIV and care coordination for patients on PrEP therapy for HIV. This role will also include routine diagnosis and management of STIs and coordination of HIV medication therapies and the HIV pharmacist. In terms of their actual budget and what they have associated with their harm reduction. 1 second here. So it looks like it is the harm reduction RN that I just spoke to, the salary and the benefits. And then I don't see any other additional supply costs. So that is a good indicator. It doesn't look like they'd be billing us for naloxone or Narcan. And they do have some administrative costs, like indirect administrative costs, but they're very reasonable. It's 34,000 for all 4 years, so a little over 8,000 per year. In terms of my notes on the actual scoring sheet, I did recommend to fund harm reduction services. I made a note that it would help them expand their contingency management program for SUD treatment, and that it would specifically expand the injection buprenorphine products for the highest risk patients.
Thanks. Morgan? Mute.
It says they're a currently funded organization, but from what I'm hearing, what they're proposing to do is entirely new, right? They do not currently have an HIV harm reduction RN, and that is what they want to do with the money, because their ask is actually quite reasonable for a large organization in a large county.
That is my understanding, yes, that they would be expanding what they currently offer by incorporating the RN, who also specializes in HIV care in addition to harm reduction services.
In the last grant, they had a very small grant for piloting the contingency management program for stimulant use disorder. $15,000.
Oh.
Norma?
I just can't, I want to underscore how important this program is as someone who's been denied care because I'm HIV positive dozens of times. I think it's so important that we fund this program. Thanks.
Any questions? All right, next, according to the chat, is Greta again for Oregon Recovers.
Okay, so this app, before I read number 7, I just want to clarify that this app is really a proposal to expand, or this application is a proposal to expand an existing app that is a recovery app along with some other services. So their response to number 7 is, we do not currently provide this, but can and will immediately adapt the website and mobile app for Spanish through direct translation as soon as we are able, with other languages coming soon through auto translation. So this is what map and a new overdose prevention training program. They also want to develop and launch an educational comic strip on effective Narcan use that will be designed by in collaboration with a Narcan expert and illustrator. It also mentions that they want to hire a peer in each county to provide local navigation to burns and recovery services. I think this might have been just part of a general statement they made in a couple applications that might have been on other counties, because I didn't see funding in their application. They don't have enough funding to hire a peer in every county to do that under this application. They also want to do overdose prevention training, hosting workshops in Multnomah County to provide monthly Narcan trainings. There would be some digital advertising and some printed materials, intervention tools, they call them, card size laminated resource guides that list countywide, Multnomah County-wide SUD resources, highlighting burns and the effective use of Narcan. So that is what this application kind of pertains to. I personally, and I guess Sarah also, didn't recommend funding it. And mostly that was just because it is not a huge ask, but this is for an app. And I didn't feel that with the competition of these funds that I didn't feel that the app and their other efforts were focused enough on the population that Measure 110 is to serve. Otherwise, the grant was fine, the costs are fine and reasonable, but we just have such limited funds. That's kind of why I came up with that idea, but that's just me, my opinion.
Thank you, Greta. Any questions? You'll see I need a Measure 110 team assist for outside in. Our reviewers are not here today.
I've got that. Unless Elizabeth wants it, I don't, maybe you can pull up the proposed budget, Elizabeth.
I can if you'd like me to. Just before we went too far, for OHSU, I just wanted to throw out one thing to kind of piggyback off of Dharma's point. I haven't seen all the applications, but I've been helping build these tables and stuff, right? This is the first applicant I have seen very plainly state that they have several IMC providers who have expertise in transgender health. So I just wanted to call that out, that this is the first proposal I've seen that plainly states that.
Thank you so much. I can help with the outside in one if somebody wants to pop it to the top of my inbox too.
I got it here.
I have it too, Morgan.
What?
I have it up too. Unless you want to help.
So for the culturally and linguistically specific and responsive services, Outside In is committed to providing culturally and linguistically specific services to key communities, including trans age youth, 18 to 24, LGBTQIA2S+ individuals, and people experiencing homelessness. We prioritize hiring diverse staff whose identities reflect those we serve, fostering trust and engagement in a welcoming environment. For Spanish-speaking clients, we provide in-house interpretation and partner with Linguava and Passport to languages for other languages, including sign language. Educational materials are available in multiple languages to ensure accessibility. Our mobile harm reduction van is equipped with video interpretation technology to eliminate language barriers in care. Many of our staff have issues such as substance use, homelessness, and mental illness, deepening understanding and trust with clients. We also collaborate with Multnomah County Burn partners to refer clients to culturally specific services within 48 hours when needed, ensuring that care aligns with each client's cultural and personal identity. They can bill. I don't have these numbered that I'm used to finding it so simple. So they are looking for substance use, peer, and harm reduction. So their substance use disorder treatment is low barrier, and they offer MAT treatment for opioid and alcohol use alongside behavioral health services that utilize dialectical behavior therapy and assertive community treatment. They're looking to expand services over the 4-year period by increasing the number of SUD treatment counselors from 1 FTE up to 2 and expanding MAT provider availability. Their peer support has peer mentors for young adults 18 to 24 and peer support specialists for adults of all ages. And they have a resource navigator that will be added to the SUD peer support team.
Yeah, and the peers are, I think, both in the office and the field. They talk about their outreach vehicle and the peers using that. And in terms of harm reduction, they want to hire a syringe exchange specialist and also additional funds for conferences and trainings and outreach, naloxone, harm reduction supplies, and drug confirmation testing costs. And I'm trying to see if the supplies are any, safer drug use supplies, syringes, strips, containers, fentanyl testing strips, wound care materials, other harm reduction tools. Any questions?
Not a question. I do want to point out that's either the first or one of the first times we're hearing syringe exchange. for all of the people who checked the box for harm reduction, and also the first time we're hearing about drug checking, which is a very evidence-informed harm reduction initiative.
All right, Painted Horse, Sean.
Right. Give me 1 second here. All right, so for question 7, yes, Painted Horse Recovery provides culturally and linguistically specific services to the urban Native American population. We lead with culture, and we also have linguistic services in our meetings held at PHR. We offer sweat lodge, drumming, beading, and take clients to ceremonies to connect with culture. Medicaid and billing, no, they do not bill, but 4D is preparing to open substance use and mental health treatment services. PHR is fiscally sponsored by 4D and utilizes their admin team to administer grants, but does not provide Medicaid billable services. It appeared that peers are both in the field and in the office, as well as with their housing. The housing offered is transitional housing and rental assistance, and they don't offer harm reduction.
Oh, I'm already unmuted. Thank you. Any questions?
So
Go ahead.
I see that only one reviewer recommended housing. Can I hear a little bit more? Like, if I remember correctly, they do operate their own housing. It's recovery houses. But do we know what one of the reviewers' concerns was around the housing?
I personally stated yes to the funding of the housing, but with a concern on how much they're requesting, due to some of the numbers in their budget or the proposed budget seeming a bit high, considering just the occupancy costs are averaging around 160,000 a year
per person.
And that's for 2 houses. They're saying occupancy at 7,500 a month. And then they go and break it down even further into like utilities at 1,200 a month, and so on and so forth. It just seemed a bit large of an ask. But I cannot say what the other reviewer thought. I think it was Ron.
Thank you.
Yep.
And what Ron, the other reviewer said, there are no details or descriptions contained in proposal regarding housing program. Proposer states the housing will meet a national standard, but does not state what the housing program actually will be. There is no mention of the gender composition, recovery status, length of stay, number of participants, anticipated community would be served, or other relevant information pertaining to the housing program. Okay. Any other?
I'm trying to take notes there. No details to the housing program. No on gender composition and what?
Recovery status, length of stay, number of participants, community served. Any other questions or comments? Now Stanley's up for Pathfinders.
All right, question number 7. Recognizing that communities of color are overrepresented in the criminal justice system, we prioritize culturally and linguistically responsive services and staffing informed by principles of diversity, equity, and inclusion, justice, and belonging. We represent a number of our direct service staff are from the communities of color and have lived experience like those we serve. We have bilingual, cultural responsive, and gender responsive peer positions. Staff in each of our peer support programs and across the agency provide services in Spanish. We have translated our marketing materials and program documents into Spanish to improve access. We use Linguava, a virtual interpreter service that enhances accessibility when communicating with other participants and their families. Linguava offers a competitive range of services, including telephone, video, and American Sign Language translation, covering over 230 languages. We have enhanced our research strategies and are conducting targeted outreach to communities most impacted by the criminalization of addiction, intergenerational trauma, and historically lack of access to services, with a specific focus on Latinx, Black, African American, and Indigenous communities. This includes providing information at applicable communities, provider meetings, tabling at community events specific to these communities. By focusing our services on those who are involved in the justice system, we will be able to target more participants who are impacted by the criminalization of addiction and who need support and services now. The services increase the likelihood of successful outcomes for these groups, easing the burden of criminalization, trauma, and lack of access to services. And
When you are pausing, I see Juliana's hand is up.
okay.
That was an accident.
Ah,
I am
okay.
so sorry.
Just waving. All right, Stanley, go
All
ahead.
right. So not able to bill Medicaid or other insurances. And they are only doing peers. And it looks like both in the office and in the community. And then I heard on some other questions, somebody asked how many peers were being hired. This one is 6 peers that are being supported. And they talk about each peer support specialist will maintain a caseload of 15 participants and provide drop-in peer support and mobile peer support and outreach services. A peer support facilitator will facilitate peer support cognitive behavioral groups and provide drop-in support. The funding expands over 6 peers. This will include a parent partner who will provide supports to systematic impact for parents through the lens of family stabilization and resilience. And that's what I have.
That's what you have? Okay, any questions? Okay, hearing none, Ariana is stepping up for Portland Health Action Team. Thank you.
So, Portland Health Action Team, here is question 7. We provide culturally specific services to the community of unhoused people who use drugs, a subculture existing outside of and marginalized by the dominant culture. In addition, our drop-in center will provide culturally specific harm reduction services to BIPOC folks. We also provide culturally specific medical recovery and housing referrals for BIPOC participants. And I want to point out that they call out in the answer to number 8, they call out trauma-informed services to individuals with physical disabilities, LGBTQ folks, and lots of Spanish language access. They only do harm reduction, and none of that is billable. They do the whole gamut of harm reduction. Morgan, I think you mentioned syringe exchange. They also do that. And everything else, like literally everything else that can be done for harm reduction. They also partner to refer out for MAT, HIV, HCV testing, things that are a little more intense. They have the best answer to how they help people who have been impacted by the war on drugs of any application I have seen. So I just want to put that out there. They clearly have really studied and thought about that. Can I answer any questions?
How long is the answer?
I can summarize. It's about 3/4 of a page.
Okay.
But just to give you an example, I'm just going to read one of the paragraphs here. Most affected by the drug war are Black, Indigenous, and people of color, and thus any attempts at reducing inequities created by the war on drugs must be rooted in anti-racism, both internally and externally. Key issues for reducing racism and harm reduction programs identified in an article from the National Library of Medicine are whiteness as a barrier to accessing services, diversifying harm reduction workers as a step towards overcoming distrust, and establishing drop-in spaces specific to BIPOC. And 110 funding will support our efforts in the following ways, and they give a list. And then this is also another sentence from another part of this. Drug war logic defies and contradicts widely accepted understandings of addiction as a health issue. It creates shame, isolation, trauma, violence. It leads to a fear of punishment, deterring people from seeking the support they need.
Thank you so much. I think that's probably the first time I've heard an applicant citing like a peer-reviewed journal for something that they're also proposing to do. That's cool.
Yeah, these folks are clearly rock stars there. That's my opinion, but it's substantiated by their application. So,
Any questions? And we, for Portland Street Medicine, we have Sean and Tatiana back on.
So with Portland Street Medicine, their number 7 is actually combined with 6 and 8, and is about a page long. Do you want me to read all of it?
I think reading the specifics about culturally specific and linguistically specific services would be the most important.
Okay, it's all kind of blended together. So I'll take a shot at it here. We believe that effective service lived experience and must also be culturally responsive. And I'm going to be jumping around a little bit here. Let's see here. Additionally, PSM is committed to coordinating or offering to the best of our ability culturally and linguistically specific services in response to the preference or request of our patients. This includes offering interpreter services or care coordination with other culturally specific providers if needed. It is also PSM's responsibility to continuously educate and train our providers and administration, regardless of cultural background, to be sensitive and responsive to our patients' diverse cultural needs. Community voices and expressed needs are prioritized and lead the work of Portland Street Medicine. And then jumping around a little bit more here, to expand access to our services, we will continue building and strengthening partnerships with organizations and community groups unhoused people's trust, including culturally specific partners embedded in BIPOC and LGBTQIA2S+ communities, leveraging these partnerships to reach people who may benefit from our care. Medicaid billing. So they currently have services now that could be billed since CMS created new mobile place of service, but they do not bill for the services due to their ongoing policies around trauma-informed care, being an HRSA qualified free clinic, and having an EHR that does not allow for billing. Their peers are in the field with screening and harm reduction. They don't offer housing, and they didn't go into a lot of specifics around everything they do for harm reduction, but they did state they do naloxone wound care and safer sex supplies.
Any questions? Morgan?
So if they're HRSA funded, this is mutually exclusive with billing Medicaid?
Sorry?
That was also one of the things I noted, is that might be worth a follow-up at some point with them if they are funded. It's not clear in the narrative why that's a barrier as a safety net clinic, unless they're feeling like it's a duplication of billing. But it's also sounds like there's just they don't believe they have been able to develop that capacity to bill too. So I just wonder if there's some missed opportunities there, and just maybe worth a deeper dive, depending on where we go with this application.
Yeah, and to expand on that a little bit, it almost, to me at least, it almost kind of seemed like they might lose their certification status with HRSA if they start billing, but that's just my opinion.
That was my question. And just like knowing the context and how they operate, I cannot imagine how they could possibly be billing for that. But I was just confused about that, like bureaucratic snag there. Thank you.
Any other questions about Portland Street Medicine?
Just noting that they're primarily almost a 50-member volunteer organization. And so some of their program costs are really critical because they are using volunteers who are needing that, that kind of oversight support. And so just FYI on that too.
Next up, we have Project Patchwork, and Stanley is up. And just noting for Project Quest, we do need a Measure 10 assist.
All right, so Project Patchwork is culturally responsive organization, and this is question 7, just so everybody knows. And we refer clients to culturally and linguistic specific services. They are going for, I believe, housing and peer support. And the peer support is both in and out of the office. And their housing is transitional, but it's also non-traditional for families, to support families. So I'll say a little bit on that. Project Patchwork is pleased to request funding for housing and peer support services. Project Patchwork has 5 houses in Portland area, 2 for single mothers, 1 for single fathers, and the other 2 homes for a mix of single parents and couples. We are asking for housing for 27 families for 6 months at a time. Then I highlighted some more just to help out. The housing folks, they meet with the clients to do needs assessments to determine their individual programs. They have, as I said, transitional and non-traditional families with a priority of keeping family members together. And billing, they do not, oh, sorry about that. They do not bill Medicaid or other insurances. All right, that's what I have.
I think that's everything. Other questions for Stanley? Okay. Let's do Project Quest. Do we have either Kathy or Ariana available? I can help as well.
I have the project scope open if you want me to read it.
Jason, please go ahead.
Number 7, Quest is designated a culturally and linguistically specific behavioral health service, CLSS, by the Oregon Health Authority for providing culturally competent care to low-income individuals, people living with HIV, and LGBTQIA2S plus community members.
And they applied for peer support and housing. And can you tell from the project scope, Jason, that the peers are in fact integrated into their housing?
Sorry, just trying to read through. It does say the peers, peer counseling and supports access as the cornerstone for all Quest programs. It doesn't say specifically there.
I got something.
Okay, perfect.
I'm in the budget workbook.
Okay.
They're asking for 2 full-time peers for the clients in our housing. These peers will support clients in meeting the goals so they can then move to stable housing situation when they're ready. And so that we know that, and so the peers are going to be based in housing, and then there are also our mileage is when peers are driving clients around, so they also work in the field. What I don't know is if you can tell from the project scope what kind of housing specifically.
Yes.
Oh,
Transitional and supportive housing for individuals with substance use. Quest Foster House, funded by Measure 110, originally saw 50% of residents find permanent housing in 2023, proving the impact of this important initiative of the LGBTQIA2S+ community in recovery. So traditional and supportive housing, and they have their own foster house.
great. 27 families, 6 supportive houses in year 3 for 32 families, and on and on. So that is the type of housing they are asking for, that they run themselves. And I think that's the 2 service areas. Are there any other questions that we can try to dig out of the application to answer for anybody? Before June pipes in? Go ahead,
If we
Jason.
want to adjust the Medicaid, they are able to bill, but they use funds for services outside of what they can bill.
Anybody else? Thanks, Jason. June, you're back on deck for Providence, Portland.
Yeah. Okay. So number 7, Providence provides care that is responsive to diverse cultural health beliefs and practices, preferred languages, health, literacy, and other communication needs. We provide these services in the proposed activities. Staff experience. All peer support staff have lived experience with addiction and possibly houselessness, mental health, and or incarceration. A quarter of BOB staff identifies as LGBTQIA2S+, 19% are bilingual, 18% are members of the BIPOC communities. We will provide culturally specific services to people of color or who identify as LGBTQIA2S+ when they encounter those staff members and refer to our CBO partners. Providence behavioral health staff attend trainings for motivational interviewing, trauma-informed care, and other courses to better serve our clients. Staff have access to 24/7 translation services for hundreds of languages provided at no cost to the client. Referrals to partner entities. When a client would be better served by a partner agency staff, be it for language or cultural reasons, we will refer and provide a warm handoff within 48 hours. Participation in the burn has strengthened our ability to facilitate such connections. This organization applied for screening, assessment, said treatment, peer support, and harm reduction. They do have the ability to bill Medicaid. They say that that they do not submit insurance or receive any type of reimbursement for their peer support specialists. And they have a BOB program, which is Better Outcomes Through Bridges program. And they have Project Nurture, which do not bill any services for Medicaid or insurance for those services. And so with that being said, their screening and assessments are very much around their said treatment program. And I just want to read exactly what they have written here for their scope, because I think that it really encompasses all of everything that they're wanting to provide. So if you just hold on one second, because I had it up. Okay, so their scope of work includes 3 BOB PSS, 1 Project Nurture PSS, 3 CADCs that will support clients with substance use disorder. Their substance use disorder treatment includes those who present in their ED, and they have Sarah, which is a 8-bed unit in their ED renovated with burn funds and opened in November 2023. It's specifically for those who present to the ED that have substance issues. They're opening a MAP Bridge clinic in ETA March 2025 to connect clients with traditional behavioral health therapies and medications to support their recovery. And they'll have one CADC that will work in their IOP program and the MAT clinic, along with an RN that will be included for their harm reduction program. Their harm reduction program is full spectrum services. And then, let me see, 1 second here. Their Project Nurture peer is a peer that works with pregnant persons, and then postpartum persons. And so they do a lot of that wraparound peer support care with those individuals. And their Bob program does most of their harm reduction, and it appears it's in the community. Their peer services, what they say, some contradictory things. They say that the peer services are going to be in their ED, but they also state that there will be outreach in encampments, shelters, and public spaces. So I didn't know if it was both or either or, but they said that in their scope of work. Trying to think if I missed anything. Their application was like full of a lot of information. So it was very, if anybody has any questions, I could try to answer, but it's a whole thing.
Ariana.
Just a point of information, I reviewed Providence for Clackamas County, and they talked a little bit more about their outreach. They do have an outreach.
Ariana, I think we have to be really careful, make sure we only talk about Multnomah County's application.
Okay, I do apologize. It sounds like it was the same sort of information.
Yeah, I know. We just
Okay,
we can
never
pull it
mind.
up and maybe it'll look the same. You're welcome to take a quick look and see if that helps add to it.
Apologies for crossing the streams.
No. I'm just
Yes.
just the referee here.
Yeah. I'm sorry, June. I'm sure I saw something in the project scope that speaks to this.
Yeah, I mean, if you could find it, that'd be great, but I couldn't find where there was a clear plan for outreach in the community. They just state that they're going to go to encampments and stuff, but they didn't really have a plan. A lot of their plan with the peers really surrounded sounds like it's surrounded around like in-house activities, including their ED. So if you could find it, that'd be cool.
Yeah, I think maybe I was just riffing off the that they did go out into the community and out to the encampments, and that they did have a team specifically dedicated to doing that. We meet clients in the community, hold and partner events, e.g. a shower truck or expungement outreach event, and have individual clients. I think that's all I could really contribute.
Thank you. Any questions for June? Okay. Last provider on page 3 of 4 is Raphael House of Portland. Danielle and Tatiana, you are up.
Yeah, I can go. So answer 7 says about Raphael House. Our domestic violence recovery mentor program team has a bilingual mentor who can help eliminate language barriers for Spanish-speaking participants, in addition to addressing and consulting around cultural barriers to accessing services. Within our advocacy center, domestic violence recovery mentor participants have access to a wide range of bilingual support groups and activities, including our peer-led economic empowerment group, and are invited to participate in our bilingual participant advisory committee. If we aren't able to meet a participant's unique needs in-house, we refer them to a culture-specific partner and collaborate closely to ensure they receive holistic, coordinated care. To repeat sensitive information. Specific culture-specific organizations to whom we refer participants include ERCO, Slavic Oregon Social Services, and El Programa Hispano with their UNICA program. On the Medicaid billing question, it says Raphael's House program and services are not eligible to be covered by Medicaid or other health insurance reimbursement. They add that free of charge services offered through Raphael's House Domestic Violence Recovery Mentor Program fill a critical gap in services for those experiencing both domestic violence and substance use disorder. The work delivered by their program consists of safety planning, case management, individual and system advocacy, and just to give you a little bit more context there, it says all domestic violence recovery mentors staff are certified recovery mentors, 3 are peer support specialists, and 2 are certified gambling recovery mentors. Their domestic violence recovery mentor team shares the lived experience of having survived domestic violence and being in recovery as well. When it comes to how our peers integrate into the offices, I have in my notes that it's both for substance use disorder and harm reduction. The type of housing that is offered is rent assistance. And the harm reduction offerings, I have in my notes that it's naloxone. Tatiana, do you have anything else that I might have missed?
Just they noted that they believe that they're the first agency that has worked intentionally to integrate domestic violence kind of screening, referral, and care coordination within a SUD treatment kind of venue. And so I think they made a strong case for why that population has some unique needs and kind of their expertise in that space.
Thank you both. Any questions or comments before we move to the next slide, which is recovery works and you need a teammate assist? Okay, we're going to move to the last slide. And as a time check, we have 45 minutes left. And it's time to discuss Recovery Works Northwest.
I've got that. Number 7, RWNW services are available to adults in Oregon experiencing or recovering from substance use disorders. We partner with culturally and linguistically specific organizations to ensure culturally responsive care. That was all they have on that. And yes, they can bill for that. And their substance use. Sorry, I get a little lost when I'm searching back upwards. So they've launched 32 beds of new residential SUD treatment capacity. And they do ASAM 3.5 and 3.7 R levels of care in the Portland metro area. What were the other questions?
So with Sudden, it's a $1.4 million ask there. Can you confirm that they will either pay for stuff that's not covered by Medicaid or insurance, or pay for clients who do not have insurance coverage?
They have a
Yes.
long, oh, okay, thank you,
Yeah.
thank you.
Yes.
They say it's coverage for underinsured or anything that's not billable.
Great. Peer support at 7:30, is that integrated into the SUD programming? And are they in the field or in the clinic or office?
They, in their SUD treatment narrative in the proposed budget, they said RWNW is requesting 1 year personnel funding to support the launch of a new 32-bed substance use disorder residential treatment facility. So it looks like they're looking just for staffing that new facility. And it's going to be direct service staff, including approximately 5 CADCs, clinical supervisor, medical director, and case manager. I don't know if I answered your question.
Are they in the field or in the office?
It sounds like they're in a brick and mortar
In
place.
the facility they're proposing? Great. And then
Yeah, that's
harm reduction at 66,000. What do they want to pay for?
Let's look and see if they had staffing. 15,000 a year. Funds are also being requested to purchase and distribute Narcan to anyone in need, specifically those who are discharging from residential treatment and those who come into our Multnomah County outpatient clinic. So it sounds like it's also a brick and mortar kind of thing.
Okay. Thank you both. Any questions? Hearing none, we've got Southeast Works, which is Amy, Madrigal,
ready.
Michelle.
I am ready. All
All
right.
right.
So Southeast Works. Of course, I click on the wrong one. Number 7, culturally and linguistically specific services. They applied for screenings and for peers funding. Southeast Works serves members of all culturally and linguistically specific communities and provides culturally and linguistically specific services to immigrants and refugees fleeing the war in the Ukraine, and services for immigrants and refugees from Russia and Eastern Europe. Drug and alcohol and DV are on the rise in these communities as they deal with the trauma of the war and resettlement. We can provide services in any language with our telephonic interpretation service. It's an interactive voice response system, they said. They are in the field. So I have this I got for you. Let's see. Sorry. Outreach. Okay. It says that they will continue, and this is important, the reason I'm reading this, says Southeast Works will continue our efforts to reach people where they are, with street outreach, including in downtown Portland, tabling at community events, flyers in health clinics, resource information through the WorkSource system, outreach in the jails, state prisons, and presentations to government agencies to connect with individuals on TANF and SNAP. We will work with other burn and non-burn organizations to receive referrals and participate in resource fairs held monthly and annually with the 3 burns. The peer support staff will provide reach-ins into the Inverness Jail, Multnomah County Detention Center. Staff will work with transition coordinators in the Multnomah County Sheriff's Department. So that's their outreach, and they are out in the field. They said that when I looked at the Excel spreadsheet and read it, it says on the screenings, most of this is for organization-wide operation operating expense allocations like liability insurance, IT services, general office supplies, durable supplies, utilities, general software, and also and that was under the narrative for program costs. It did not sound like they're adding new services at all. They're just asking to fund the program managers, admin assistant, executive director, and it's weird how they put this, are charged 30% to program, 7% to screenings, and 63% to peer support, as all provide direct services to clients. Peer support specialists are charged 10% to screening and 90% to peer support. Benefits include Medicaid, dental. So what I got from this and what I looked at and reading with it was that they were basically covering their staff. It's not, they put in there that they already received 4-point-something million other funds, and they use that for the cost too. But I mean, the service they provide is great, but I did not recommend funding them when I read it, and it's just because of what I was seeing. They weren't really expanding anything. They weren't doing anything else. And I appreciate that they're focusing on the areas that they are, but I just felt like it's good that they're a part of the burn, and that's all I have to say.
I want to mention that they do not bill Medicaid.
I'm sorry, what was that?
I just wanted to highlight that they
they don't charge bill Medicaid.
Do not bill Medicaid.
Nope.
Thank you. Thanks, Amy. Any questions for Amy? Okay. I think John hopped off. To leave did share her Excel kind of report tools with Aria and Kathy via email for the fourth dimension. So Savalti, and I'll pull them up as well.
For question 7, Savalti is specific and intentional in who we serve and how we reach our clients. All of our CADC counselors and group facilitators identify as Black or African American and have lived experience with domestic violence, child welfare, substance use disorder, gang violence, and the criminal justice system. All of our contracted peers have prior experience in a wide range of organizations, including state, county, and local government entities, as well as other community-based organizations. Our counselors are experienced in recognizing SUDs and are trained in our unique methodology to engage with and support our clients.
Thank you, Kathy. And they applied for peer support. Are they in the field or in office? And how are they associated with programming?
They say that their peer support recovery specialists provide one-on-one peer recovery. And it doesn't specifically say if it's out in the field. My guess is yes, but unless I read that. They do life skills support. And they have a place that welcomes clients and to celebrate holidays and recovery milestones. They have a fatherhood engagement group, a batterer intervention group for men, and therapeutic parenting, visitation, and support.
Any questions about this application? Thank you, Ariana, standing in for Emily. Go for it.
All right, question 7. This is for 4D. 4D believes that adolescents and young adults fit the definition of culturally and linguistically specific services, and as such has developed an age-specific peer best practice manual that supports adolescents with tailored programming. They do not bill Medicaid, but they are preparing to open substance use and mental health treatment services. And when they are able to provide Medicaid services, they will take considerable measures to ensure no supplanting occurs. Their peers are in the field and the office. The peers are integrated into housing and harm reduction. Their housing is like a shelter-based transitional housing, and they offer naloxone only for harm reduction. Questions?
None? Okay. Thank you, Danielle, for confirming you're up for the Alano Club. Thank you for covering.
Yeah, of course. So the Alano Club, for answer 7, they did not answer this question. They put an NA there. However, in a previous answer, they mentioned in the application that their staff is 50% of color, but they did not identify services rendered in a culture-specific and linguistic manner. They also do not, for the 2 questions about the billing, they said no to the 2 billing questions. Let me go down my notes here on if the peers are in the field or in the office, my understanding that it's both. On the how peers are integrated into other services, according to what I read, it's for both substance use disorder and harm reduction, it's both the field and the office. No housing services are offered. And on the harm reduction offerings, I have here naloxone, syringe exchange, very difficult word to pronounce for me, and wound care.
Any
And that's all I got.
Okay, yep, those are all of the areas. Any questions about the Alano Club? Yours. Okay. Thank you all. Sorry, Grace, I didn't give you a whole lot of notice, but you are up next for the Everly project.
Sorry, I'm gonna have to pull up the application. For some reason, I skipped out one setting is the Excel sheet. So 1 second. Question 7. We provide linguistically specific services to the Latinx community living with HIV at our weekly HIV services. This includes an interpreter present for our harm reduction group and 2 Spanish-speaking staff members. We have a thriving Spanish-speaking community at those services, many of whom are living outside. Most identify as LGBTQ, and most have little to no English language. While we currently have 2 Spanish-speaking staff members, we plan to hire a Spanish-speaking case manager who is bilingual and bicultural to assist in growing these services. Provide specific services with those details. And then the other question was about Medicaid. We pulled that up. They do not offer any services that are eligible for Medicaid or other health insurance reimbursement. For peer support, I'm gonna have to pull up their budget really quick. Sorry. Everly. If anyone has it pulled up, that would be great. But I'm opening it up right now. Um, so it says they don't have screening or assessment or SED. Harm reduction. Yeah, harm reduction. They have one FTE executive director responsible for growth and development of the organization. Provides design vision for harm reduction kits. What else do I see? They also do required trainings, which include first aid and CPR, de-escalation, crisis intervention, and health illness. Did I miss a question? They only
Yeah.
have reduction.
I got you.
Thank you.
The question is about the menu of harm reduction supplies, and they are, let's see, food boxes, holiday meals, hydration supplies, bottled water. Events, Remembrance Day, organization, tables, bringing supplies to the community. It does not say specifically. Oh, here it is. I found it. Harm reduction supplies for building safer use kits for day center participants and for secondary distribution by community partners. Participant assistance for eviction prevention, replacing IDs, phones, birth certificates. So that is a summary of their kind of supplies section of their workbook, their budget. And let me see if there's anything else to share. I keep sliding this window way over so I can see the whole thing now. I can't see you all. There we go. Yep. Okay. So the harm reduction supplies starts at 55,000 and goes up to 85,000 and per year for the 4-year grant. And the rest of the budget is really built out. They've got rent and other staff as well. And they do have peer support salary, case manager salary, bilingual case manager, nutrition, housing specialists, and some interns and 4 stipends for PWD, all included as well. So it seems like it's a pretty robust harm reduction program, not just handing out supplies, which would make sense with the $6 million budget. But that's a high level overview. Any questions about that? Well, I'm waiting for you to ask. Insight Alliance also needs a Measure 110 assist. Can we go hop over to there?
I've got it. This is one that was reviewed by Greg. Question 7. The Insight Alliance is committed to providing culturally responsive and inclusive services to diverse populations affected by the carceral system, with particular attention to the Latinx community. We have 2 bilingual employees to offer services in both English and Spanish, ensuring that language barriers are minimized through translation services for native Spanish speakers. Partnerships with organizations like the Latinx Network enhance our understanding of the unique needs of this community regarding incarceration and reintegration. We also prioritize ongoing cultural responsiveness training for our staff, ensuring that our services are sensitive to the diverse backgrounds of our participants. Additionally, our Insight into Wellbeing curriculum is designed to be universally applicable while accommodating cultural nuances, focusing on the innate resilience and well-being of all individuals. This adaptable approach allows us, unfortunately, this is cut off. It will take a minute to open that. I'm gonna continue on. Notes about Medicaid and billing here. Oh, one moment. This adaptable approach allows us to effectively serve various populations, reflecting our commitment to fostering kinder, stronger, and more equitable communities for those impacted by the carceral system. And unfortunately, it looks like the same thing was posted into notes about Medicaid and billing, so I would have to look that up. Their peers are in the field and the office. They're integrated into screening and assessment and housing. The housing is shelter-based / transitional, and it does not look like they do housing, or harm reduction rather. I think that they just applied for peer and housing.
Yeah, so Morgan's question is, and I'm trying to pull it up also, Ariana, is do they provide their own housing, or is that funding, that $1.1 million funding to support other housing?
That is a very good question. Two transition and recovery houses for female identifying individuals impacted by incarceration. It is transitional. They offer recovery housing that's abstinence-based, which is where their peers work. And then transitional housing for individuals experiencing homelessness with supportive services to facilitate independent living. They have a capacity of 12 residents across both houses.
Great. Nice work finding that. Awesome.
Sheer luck.
Any questions from what you've heard? Okay, Greta, you are up.
Okay. All right. Question 7.
Sorry, we should say this is the Marie Ecke Institute.
Okay. For a decade, we have offered culturally specific services to marginalized LGBTQIA2S+ people, including unhoused and disabled people, BIPOC, people with significant mental health concerns, people who use drugs, elders, and people with complex and ongoing trauma. Our team brings diverse lived experience with recovery, poverty, being homeless, disabled, queer, trans, autistic, Jewish, racialized, as people of color and Spanish speaking. We provide equitable care that is uniquely tailored to one's health goals and needs, especially as it relates to one's gender identity, sexual orientation, race and ethnicity, ability, and housing situation. So this entity is not a Medicaid eligible entity, so they do not bill Medicaid, and they're asking for peer delivered services and harm reduction services. The peers are going out in their community, reaching the population, and also working internally in their day centers or a center. So they have their own center, which the budget covers about 20% of that facility's cost. So those peers are running groups and going out into the community. And then with the harm reduction services, they will be going out into the community, reaching the LGBTQIA2S+ folks who use drugs and are in recovery. Through a range of services and educational initiatives, they will distribute Narcan, sterile syringes, drug checking kits, and safer use supplies, bolstered by peer-delivered education and skill building. So recipients are empowered with appropriate know-how. They're also going to be doing in-reach and outreach at their center, as I said, and at specific queer and trans-specific clubs and dances, distributing supplies and pamphlets. Gonna install additional Narcan cabinets at community partner locations and do training sessions on Narcan use and overdose prevention. Wound care services will be established in a dedicated room in their center. And They're going to collaborate with the Cascades AIDS Project to assist with on-site STI testing and use of CRMs to host a variety of weekly harm reduction support groups, which includes Drunk Punks, an alternative to AA, and groups specific to neurodivergent, queer, and trans folks in recovery.
Thank you. Any questions? Okay. Moving over to Transcending Hope. Thank you, Kathy. I will assist as well.
So the question 7, over 30% of the community we serve at Transcending Hope identify as Latinx community members. To ensure that our programming is culturally and linguistically specific, we employ a dedicated team with Latinx background. This team includes 7 house managers, 2 housing navigators, 2 case managers, a supervisor, and a program manager. Our team is instrumental in providing support to residents and ensuring that the services are delivered in a culturally sensitive manner that reflects the diverse experiences of the community. These 3 homes are specifically tailored to cater to the needs of Latinx men, women, and families. These homes are meticulously designed to provide culturally and linguistically appropriate services, ensuring that residents feel heard, respected, and supported in ways that resonate with their cultural identities. The organization has extensive experience in providing culturally responsive housing, and in cases where residents require additional what is offered, we have established a system to connect them with community partners who can provide peer services and culturally sensitive care, ensuring that everyone receives the appropriate assistance. Transcending Hope is under the leadership of Dina Fields, the executive director. Dina Fields identifies as a person with lived experience in long-term recovery and a biracial Latino woman. She has firsthand experience navigating complex systems related to mental health while supporting her son, who is dealing with co-occurring schizophrenia and substance use disorder. With her personal professional experience as a peer mentor and with extensive lived experience, Deanna brings valuable knowledge to the project that is crucial to its vision and understanding of the population it serves. They do not bill for Medicaid. I believe that they have I had it in my lines of sight.
I got it.
Oh, yay.
So they don't, correct, they don't bill, and they are only applying for housing, and the funds will cover various needs, including costs for housing facilities, utilities, general household supplies, hygiene products, basic household items, bedding, Narcan, safety training, flex funds for essential needs such as food, bus passes, birth certificates, deposits, storage, and wallets. The funds will also cover staffing costs for live-in house support. So it is them providing their own housing, as well as a dedicated team comprising the housing navigator, supervisor, and program manager. Comprehensive approach aims to provide a supportive and nurturing environment. Those are the key questions for every application. Are there any inquiries that Kathy and I can entertain before we move on to True Colors Recovery? And if either Kathy or Ariana can grab Emily's report on True Colors.
I've got it.
Okay. Oh, 15 minutes left. That's amazing. Okay. Thank you, Carly. Go ahead, Ariana, on True Colors.
Question 7, reactively conduct outreach in BIPOC communities to invite marginalized groups that identify within the LGBTQ community into our services, ensuring inclusivity and accessibility. Our intake forms are translated into Spanish. We have 2 staff members who can provide services in Spanish to better support our diverse clientele. Additionally, we have hosted recovery meetings exclusively for BIPOC members, creating safe and focused spaces for healing. We also held a Wellbriety meeting at our center, further reflecting our commitment to culturally specific recovery support. They do not bill Medicaid. Their peers are in the field and the office. They are integrated into harm reduction, and for harm reduction, it looks like naloxone is the only thing that Emily listed.
And there are zeros next to housing and screening. And there's not a big program ask do you think we can infer that they're not applying for screening and housing? Did you get any of that from her report?
I did not. I think I would like to just pull up their thing and verify real quick what that's about, because what I seem to recall is that they didn't get recommended for those, but I want to make sure I'm remembering correctly.
Yeah, one of no and and I'll let June know she's on deck next for VOA when we're done answering this question. So I just want to make sure all of the orange areas get clarified.
Okay. These the no's should have been NAs.
Okay.
They
Great.
did. Yeah, that's why it is.
Okay.
So they only requested peer support and harm reduction and were recommended for both of those.
Okay. Any questions? Okay, June, take us away with VOA.
Okay, number 7. VOA Oregon offers culturally specific treatment curricula and culturally specific recovery houses, including a recovery house specifically serving Latino men and a recovery house specifically serving Black men. Our certified recovery mentors have lived experience with substance use and reflect the clients being served culturally, which supports the creation of an environment of belonging and safety for our clients. VOA Oregon also provides culturally responsive services that respect and respond to the cultural heritage of our community and the people we serve. We have redeveloped programming and are actively making further adaptations in consultation with our peer workforce and community to more fully integrate culturally responsive services. We also actively partner with culturally specific community organizations, both to inform our programming as well as to refer clients who are seeking culturally specific services that we are unable to provide. This organization applied for screening, assessments, SED treatment, and peer support. Let me go up. Their screenings are their screenings are primarily being conducted by a team of 6 recovery mentors funded by Measure 110, who will work with each client to link them to services and supports that best. Inverness Jail and community outreach events. Without the funds, VOA Oregon would not have the capacity to provide community-based screenings, is what they say for screenings. Let me see here. Sorry, y'all. This is one that I did a long time ago, and obviously can't remember everything. They say that currently that they do not dedicate assessment clinicians, and assessments are conducted by behavioral health counselors who have openings in their treatment schedule. So by being funded, they would be able to add more FTE in order to complete behavioral health assessment needs in a more timely manner. Their low barrier treatment that they're wanting to offer it appears to be outpatient treatment, not inpatient treatment. They say that M110 grant funds will support contingency management and incentives, treatment for uninsured and underinsured clients, case management, and safe, welcoming treatment spaces. And their peer support, they say that BOA's team of 6 certified recovery mentors will provide peer support to clients engaged in said treatment services, as well as individuals met through community outreach efforts. VOA Oregon is partnering with the Multnomah County Deflection Center to provide real-time access to peer mentors and connecting InReach to Multnomah County Inverness Jail. Yeah, so it sounds like they're in the community some, working with other systems. I hope I answered most of your questions.
Yeah,
Sorry.
that's good. Any questions for June on BOA's application? Just over here, few comments about deflection in this county. We have 8 minutes, and I'm going to keep moving forward. West Coast Housing, please, Grace and or Juliana.
And read that. Culturally and linguistically specific services. West Coast Sober Housing has experience providing culturally and linguistically specific services, including dedicated support for the LGBTQIA2S+ community, a house dedicated to LGBTQ+ culturally informed services for the Indigenous community and Spanish-speaking community. Our programs are designed to meet the unique needs of these populations, including offering inclusive, trauma-informed care that respects their identities, culture, and lived experiences. This approach ensures that all residents receive equitable, affirming support throughout their recovery journey. They cannot and do not bill Medicaid. They're applying for peer support and housing. So their peers, I didn't see any discussion of their peers going into the community, but it looks like they currently employ peers. Are seeking funding to increase peer support FTEs, in particular for the LGBTQIA2S+ programming, recovery mentoring, and for peer supervisors. They're hoping to increase staffing for higher retention and higher success rates for clients, and they are integrated into their housing and their supportive housing. So they provide actual housing. They have facilities for men, facilities for women, and facilities for LGBTQIA2S+ individuals. They don't have to maintain their sobriety, or they're not released from the program if they don't maintain their sobriety, and they make plans for them to get them back on track if they do.
And what kind of housing is it, Juliana?
Supportive housing.
Supportive housing. Okay. Thank you. Those are the questions. Any follow-up for Juliana before we move to Women First? Thank you. June, you're back.
I am. Lucky you all. Okay, Women's First, number 7. Women's First is a culturally specific and culturally responsive organization providing services to Black women and women of color. 90% of our employees and board members are Black women with lived experience matching that of the community we serve, including 20% who have been incarcerated. Our approaches are informed directly by the experience of our leadership, women survivors who have faced adversity, lived through pain, and made it their mission to make Oregon a better place for underserved women of color. Our founder and executive director, Shannon Olive, is a strong Black woman with a natural inclination to fight for justice. Shannon is a survivor of abuse, addiction, foster care, parental loss, and incarceration, and she has dedicated her adult life to helping Black women break the damaging cycles that limit their potential. So, this organization applied for peer support and housing. So just one second here. I don't have help with this one because Greg isn't here.
Oh, I have
It's
it.
not. Oh, good. Okay, so I'm not really clear if this organization does. It's just not clear from their application if they're out in the community, but they do say that this their peer service is available 24/7.
I have Greg put that their peers are in the field and the office, and that they're integrated into screening and assessment and housing in both cases.
Yeah, and I hadn't even scrolled down to housing. It says Women First has 2 housing programs, both geared towards women in different stages of their recovery. We are guided and certified by NAR, which regularly helps guide us in best practices through all of our programming and housing endeavors.
And what kind of housing is it? Is it supportive housing? Is it transitional housing?
I have that it's shelter-based.
Shelter?
Mm-hmm.
Okay.
And then for harm reduction, I don't think they
No
apply
harm reduction
for that. Okay.
Nope, just peer and housing.
Okay. And those are integrated. Great. Any questions about Women First Transition and Referral Center? Okay, we have one to go, and I put a note in the chat about our next meeting. So we have Greta and Kirsten with Yassine's Louvre. I don't know how to pronounce this organization. Say more, Kirsten.
Well, I think it's Yassine's. Greta, are you here too?
I'm here.
All right. All right. So this organization is applying for harm reduction, SED treatment, peer support, and housing. They are empowering holistic maternal health initiative. That's the purpose of their program. I may have made a mistake on the harm reduction because I said no to harm reduction when I looked, because a lot of their harm reduction is around addressing food insecurity and creating relationships with local organic farms. And when I looked at the definition of harm reduction that we were supplied, it was a lot more, food insecurity, food wasn't in there, but it does say can be as not limited to. So now I wonder if I should have not said no to that on harm reduction. So I want to put that to the side. So as far as question number 7, let's see. I had it pulled up. Okay, here. As a doula service that specializes in, so the question number 7 was very short. I just said, yes, we provide culturally specific services for Black and Indigenous population in Portland. But then it went on to say, as a doula service that specializes in SUD harm reduction, peer support, treatment, and housing, we have over 30 years experience providing SUD-related services for pregnant persons and non-traditional parents with minor children. That includes trauma-informed care, culturally and linguistically specific and responsive services for the Black and Indigenous community, gender-affirming and responsive care for pregnant persons who do not identify as female, and care that is inclusive of the LGBTQAIS+ community. Our support groups and services for mental health also support those who experience intellectual and developmental and physical disability. So as far as the peer supports, they are, so it's a doula organization, so they want to increase their peer support to peer support specialists who are also doulas, and then 2 backup peer doulas. And they will also expend the pregnancy and infant supply clothing closet to increase diaper donations to support families, and really want to have a larger space for storage and where parents can shop for things that they need, and also for a place for the peer support for the increased staff to meet. And as far as housing, they are planning, they want to establish 2 types of housing, a family transition housing and a postpartum respite housing. So this does include renting 2 6-bedroom houses, outfit with furniture and supplies to have 2 distinct housing resources. And as far as Medicaid reimbursement, some of the services are Medicaid reimbursable, but not all. And I believe this is a current burn, and so they are already already not billing Medicaid for services that are outside that. Let's see. And then, and as far as SUD treatment, they would like to hire 2 CADCs and train them to work with the doula supported pregnancy sector. And we'll also increase our doula support team to include a doula certified midwife, pregnancy and birth doulas, postpartum doulas, and peer lactation counselors. So really a holistic, comprehensive approach to sort of the whole continuum. They also had a piece in their application about co-parenting and fathers and non-traditional parents, and they actually added pregnant persons to the list of areas to focus on as far as that question number 7, which stuck out to me. And Greta, I don't know, do you want to add anything else?
No, you covered it really well. This was a really great application of an integrated model approach, although very expensive ask for the funding that we have. But yeah, it was a great application. And they did mention that they do get Medicaid coverage, and they're going to use Measure 110 to kind of, they mentioned something about the ODULA reimbursement rate being too low. ODULAs are not very well reimbursed. And so that's what they're going to use the additional Measure 110, some of the additional Measure 110s for.
So that people wouldn't have to pay out of pocket for doula support services, that they would be able to use that to supplement that.
I will also say this, that's not really high ask. So if it does end up getting cut there, I don't know exactly how they would cut, but they did ask for some money for an annual conference that they wanted to put on, and hosting of those types of conference events, and that may not be as necessary in the application.
Yeah, and I was curious too around the cost for the additional space for staffing and that sort of thing. And, some of those things maybe we could cut out. But I also agree it was a really unique program that we haven't heard much in other applications. So anyway, any questions?
Thank you for that. Any questions? Yes. All right. You made it through all of the Multnomah County applications. Kudos. That was 56 in 4 hours with a 4-minute break. So thank you for sticking around. Monday, we do meet. We meet at 1 o'clock, and we're going to meet until we're done. I hope. Not Monday. Monday is a holiday. Tuesday is the day we're meeting. Tuesday, not Monday, Abby. From 1 to 5 at least. To vote on Multnomah County and finish Washington, and I think Union is the only other county that's left. I believe I'm correct with that. So Washington County is going to be another big one, but not quite as big as Multnomah. So please come ready to go on Tuesday afternoon. I'll see you then.
Hey, Abby, I had a question.
Yeah.
Just with all the would it be possible to send out the proposals ahead of time so we could look at them prior to the
I
meeting?
sent out the slides yesterday.
Oh, they were already sent out. Oh, perfect. Okay. I didn't realize those were in there too. Great.
Can I just
Thank you.
request? I'm getting so many Measure 110 emails that I can't effectively search my inbox. And so if like the subject line or something, this is where the
materials in the subject line, panel review materials. And Carly has to send the applications to the OAC members one at a time because of the size and some of the technical difficulties y'all have had opening them. So that's why we all just got about 1,400 emails from Carly during the last few minutes. Yeah.
All right, exciting. And then so Carly, you're gonna be like
Thank you.
Bye, everybody.
Bye.
Morgan,